Good morning, ma'am.
Mr. Eddie Marjuang, are you all ready? Are you ready? Are you ready, sir?
Yes, ma'am. We are ready, ma'am.
Stroming, Pak.
My name is Dasin Melantindraha. I come from NES Iceland, and don't forget I'm second semester. Well,
Laboratorium English and Computer. In Laboratorium English has
Good morning, ladies and gentlemen. Please welcome the second day, the first Mitra Husada Health International Conference, June 29 until 30, 2020, Medan, Indonesia. The Honorable Madam Siti Nurmawan Sinaga, the Chief Institute of Health Science, Mitra Husada Medan. The Honorable Oral Presenter from Laos. The Honorable Oral Presenter from Germany. The Honorable Oral Presenter from Malaysia. The Honorable Oral Presenter from Indonesia. And the Honorable Oral Presenter in the first Mitra Husada Health International Conference. Ladies and gentlemen, before starting our agenda, let me explain the agenda schedule of the second day in the webinar international. First agenda, welcoming and greeting. The second agenda, opening prayer. The third agenda, sing the march song of Stikes Mitra Husada Medan. And the fourth agenda, oral presentation. The fifth agenda, best paper and best oral presenter announcement. And the last agenda, closing speech from greeting the Chief of College Stikes Mitra Husada Medan, Indonesia. Ladies and gentlemen, now we are going to the next agenda, is opening prayer that will be delivered by Mr. Julkarnain Batubara, For Mr. Zulkarnain Batubara, time and place is yours.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Ladies and gentlemen, I will guide this prayer based on the teaching of Islam. And those who are not Muslim, you are pleased to pray according to each of your beliefs. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala asrofil anbiya wal mursalin wa ala alihi wa sahbihi rasulillahi ajma'in. Oh Allah, today, June 30, 2020, in this beautiful place, in the second day, we gather here to bring about a webinar international, the first Mitra Husada Health International Conference. The theme is Emergency Management COVID-19 of Reproductive Health or Saving Life. Make this webinar international conference as a useful science assembly, as a medium sharing useful ideas, knowledge, and experience of scholars, researchers, and students of various disciplines. May the conference we organize today benefit to our lives, broaden our knowledge, and shine our ideas, and let us to be successful, productive person, which in turn will boost dignity of our nation. Oh Allah, protect us from unintended temptation, show us the right path, and give us knowledge and strength to perform good things. Equally, show us and make it clear and the bad things, and give us knowledge and strength to avoid them. Oh Allah, you are the one who can fulfill our dua. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you to Mr. Zulkarnain.
Unmute Pak Adi, unmute.
The fourth agenda, oral presentation, will be moderated by Mrs. Retno Wahyuni. In oral presentation, we have some judges. Judges in section 1 and 2 are Mrs. Hernarinayanti Manurung, and then Mrs. Febriana Sari, and Mrs. Srilina Pinam. Judges in section 3, 4, and 5, Mrs. Lydia Natalia Sinuhaji, Mrs. Luciatun, dan Mrs. Siska Suci Triana Ginting. During oral presentation, the judges will give assessment for oral presenter. So give the best performance. Now for Mrs. Retno Wahyuni, time and place is yours.
Okay, thank you for the time that was given to me by Master of Ceremony. Well, ladies and gentlemen, may I have attention, please? Our oral presentation will begin. Please have a nice seat and thank you for preparing yourself to join in our oral presentation. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody.
Morning.
Okay, well, hopefully all of you fine for today, right? Ladies and gentlemen, I am Retno Wahyuni as a moderator in the first and second session in this oral presentation. This oral presentation will discuss about the role of nurses and midwifery in the protection of elderly, reproductive health, and also coronavirus prevention strategy. Well, before the presentation begins, let's know the regulation how the oral presentation will be going on. Firstly, I'd like to give the time the presenters that they present the material for about 5 minutes. Secondly, I want to tell you that the judges in this first session, there are Mrs. Lydia Natalia Sinuhaji. Hello, Mrs. Lydia, how are you?
I'm fine, Miss. Thank you.
Okay. And the second judges, Mrs. Luciatun. Hello, Mrs. Luciatun.
I'm fine.
Okay. And the last judges from Mrs. Srilina Pinam. Hello, Mrs.
Hello.
Okay. The judges is already right?
Yes, I'm ready.
Okay. And the third oral presentation assessment consists of organize the presentation, communication, and also material suitability. And now we are going to in the presentation time. Well, ladies, the first presenter from Desi Fitria Borusi Laban. Time is yours, Desi.
Thank you for the time, ma'am. I will explain a little information about physical activity and exercise during pregnancy in COVID-19. Let me introduce myself. My name is Desi Fitrinata Silaban, student of Diploma 3 of Midwifery in Institute of Health Science, Mitra Usara Medan. From the abstract, exercise may not be a cure for depression and anxiety during pregnancy, but it certainly seems to help. A systemic review of physical exercise during pregnancy for healthy women found that it is safe and beneficial for mother and child. Exercise while physical distancing is important as it can help improve your mood, reduce back pain, improve your posture, prepare you for childbirth, and more. According to the BKKBN, or National Population and Family Planning Agency, pregnancy is a process that begins with the release of a mature-8 of fallopian tubes which they meet with sperm, then both fuse to form cells that will grow. The increasing status of the coronavirus in Indonesia might make most people feel scared and worried, especially for pregnant women. In normal conditions, approaching childbirth sometimes makes some pregnant women worried, especially if they have to give birth in the middle of a corona outbreak. This can certainly be quite stressful. Well, the key to calm down and multiply useful information to reduce you worry, mom, because aside, worry can also make pregnant women stressy. But the most basic is to apply the COVID-19 health protocol is wash your hand frequently, avoid touching your eye, nose, and mouth, put space between personal and other, cough or sneeze when you're bathed with a tissue. If you have fever, cough, or difficult breathing, wear care early, call beforehand, and follow medical advice. This recommendation has been approved by World Health Organization. And the following health tips pregnancy women during the COVID-19 is the first, you must eat the nutritional balanced and healthy and consume enough vitamin for pregnant women. The second, perform like physical activity such as yoga or pregnancy exercise and take blood boosting tablet according to the recommended dosage. Keep your personal and environment clean and diligently wash your hand for at least 20 seconds and avoid leaving the house if not needed. It's forced to leave the house, wear mask, and desk tight clothes. And the last, regular sunbathing to increase the vitamin D levels for pregnant women. There is research that shows that vitamin D deficiency can trigger the risk of premature pregnancy. And the regular exercise during can improve health, reduce the risk of excess weight gain and back pain, and it may make delivery easier. Moderate exercise during pregnancy may give a newborn a healthy start. The first is birth walking. If the pre-pregnancy exercise level were low, a quick stroll around the neckboard is a good way to start. This will provide the cardiovascular workout without too much impact on the knees and ankle. It can be done for free almost anywhere and anytime during pregnancy. For the safety tip, choose smooth surface, avoid potholes, rocks, and other obstacles, and wear sportive footwear. The second is swimming. Swimming and exercise in water give a better range of motion without putting pressure on the joints. For the safety tip, use the railing for balance when entering the water to prevent slipping. Avoid diving and jumping, as this could impact the abdomen. And avoid warm pools, steam rooms, hot tubs, and sauna to minimize the risk of overheating. The third is stationary cycling. Cycling on stationary bike, also called spinning, is normally safe even for the first time ever exercise. The bike helps support body weight, and because it is stationary, the risk of falling low. And the last is yoga. Prenatal yoga classes keep the joint limber and help maintain flexibility. The technique The yoga stranger muscle stimulation boosts circulation and enhances relaxation. They may contribute to healthy blood pressure during pregnancy. For the safety tip, as pregnancy progresses, skip the position that could cause you to overbalance. And the last is attention. Exercise is rarely harmful, but anyone with a medical condition, such as asthma, heart disease, hypertension, diabetes, or a pregnancy-related condition, should speak to a healthy care provider first. Exercise may not be advised if there is vaginal bleeding or spotting, low placenta or placenta previa, a history or possibility of meriscal or preterm delivery, weak cervix. And stop exercise if you feel fatigue, develop persistent pain, experience any vaginal bleeding, and have regular contraction more than 30 minutes after exercise, as this may be a sign for preterm labor. A healthcare provider can suggest personal exercise with guidelines based on the individual's medical story.
Okay, I'm
That's
sorry,
all for me.
interruption.
Back
Okay.
to the moderator. Thank you.
I'm sorry. Okay, it's past 5 minutes for the first presenter. Thank you. And the next turn is for the second presenter from Selvi Indah Saputri. Time is yours.
Okay, thank you very much for the time given to me. Before I start my presentation today, let me introduce myself. My name is Selvi Indah Saputri. I come from Stikas Mitro, Medan, Indonesia. Okay, my title today is Factors that Affect Occurring in Pregnant Women with Compliance with the Tablet of the FE in Clinic Remenda Boru Tarigan, Medan Denai District in 2019. Okay, the first background. Okay, the first background. Anemia is the health problem of the world community that can increase morbidity and mortality rates. The prevalence rate of anemia is still high, evidenced by the World Health Organization in 2012. The global prevalence of anemia in pregnant women around the world is 41.8%. And the second background, anemia is a problem that still occurs in women, especially in expectant mothers. The prevalence of anemia in pregnant women around the world is 31.8%. Incidence of anemia around the world, 50% iron reserve less. The third background, based on data from the Provincial Health of North Sumatra in 2010, the prevalence of pregnant woman anemia in Indonesia by 70% or 8 until 10 pregnant women suffering from anemia. The last background, the coverage of pregnant women who got 90 iron tablets in North Sumatra showed a decrease of 84.3% in 2014 to 74.42% in 2015. This figure is still for frame the specified target of 80%. Okay, the formula problems based on the background description above, the problem of health factors that affect the pregnant woman in the clinic Remenda Boru Tarigan in 2019. Okay, the purpose of this research is to find out the factors that affect anemia occurring in pregnant women in the clinic Remenda Boru Tarigan. The benefits of this research can be an input for expectant mothers to increase the factors that affect anemia occurring in pregnant women. Okay, material and methods. The research design is an analytical survey with a cross-sectional approach, which is the translation of a relationship between two variables in a situation or a group of subjects that are conducted to see the relationship between the other variables. The goal is to know the factors that affect the anemia occurs in the clinic Remenda Boru Tarigan District Denai Kota Medan. Okay, the first independent variable, based on the factors, the first knowledge, the second education, the third age, and the fourth gender. And the second dependent variable is anemia in pregnant women. Okay, based on the result of this research, non-respondents have sufficient level of knowledge but not obedient in the implementation. FE tablets in the clinic remainder borutarigan is as much as 4 or 36.4%. While a small part of the mother with less knowledge but an obedient to consume FE tablets, a number of 15 people or 88.2%. Test results statistic obtained p-value equals 0.00 or value p less than a or 0.05 thus. The HO rejected and HA received. This indicates that there is a knowledge relationship with the adherence to the application of the consuming FE tablets. Okay, the first conclusion of 34 respondents who have a level of knowledge that affect mother anemia in pregnant women who are 70 people or 50%. Analysts have a good level of knowledge 6 people or 20.6%. The second conclusion of the 34 respondents, most of the degree of the disobedience consuming of the tablet FE 19 people or 55.9%. Analysts a degree of obedient consume as many as 15 FE tablets or 44.1%. The third conclusion for 34 respondents, most of the age are known to male respondents with an age of less than 20 years, 18 people or 52.9%, and at least the age of more than 35 years, 6 people or 70.6%. And the first conclusion from 34 respondents is MP education level 11 people or 32.3%, and high school education at least 6 people or 17.6%. And the last conclusion from 34 respondents, it is revealed that many respondents worked there 22 people or 64.7% and did not work less than 12 people or 35.3%. Okay, thank you. Until here my presentation, I come to moderate.
Okay, thank you for Selfie. That is good presentation. Okay, to the participant, I just want to remind again and to the presenter that your presentation only just 5 minutes. And to participant or audiences, if you want to ask, you can chat in our Zoom and also in our YouTube. And in the last section first, I will be share the question and the presenter will be give you the answer. Okay, thank you for the attention. And we next to the third presenter, that is from Donna Betaria Tampu Bolon. Time is yours, Donna.
Thank you for the time that giving to me. Before I go to presentation, let me introduce myself. My name is Joni Bolon. I'm a student Bachelor of Midwifery in Stikes Mitra Sada Medan, semester 2. My presentation is about husband support relationship with compliance of antenatal care examination in pregnant woman, CM3 at Primary Clinic Pina in 2019. Then the background is, according to World Health Organization or WHO, there are 216 deaths per 100,000 live birth due compliance of pregnancy and birth in 2015. Indonesia is the one of developing countries as the highest contribution to maternal mortality in the world. Then, husband support can be emphasized as a source of high-throat interaction with others. Some support the response to use through our interaction with other people. Another opinion that support about information from others is his love and care for, has self-esteem and appreciate, as well as being part of a network of communication and mutual obligation. 。    。 Then, however, encourage the husband and be more involved that the birth, where is acceptable, made also beneficial for the whole family. Birth was very emotional experience for some people, especially husband or partner, having more active involvement can be the whole process fuller special. Then, based on the initial survey conducted in the primary clinic of Ina, there are 25 pregnant moms who conducted were not delivered by the husband. So other is interest taking up a title about husband's support of ANC examination compliance. Then the formula problems based on the background of the problem above, the problem can be formulated is there are relationships between husband support and compliance with antenatal care examination in pregnant woman at the Pratama Clinic in 2019. Aim or purpose from the text about knowing that relationship of husband support with antenatal care or ANC compliance for pregnant women at the Pratama Clinic in 2019. Then material or methods. This research is quantitative study using analytic survey with cross-section research with a retrospective approach aimed at knowing the husband support relationship with compliance of antenatal care examination pregnant women at Pina Pratama Clinic year 2019. Taking the total sampling technique because the population is less than 100. The entire sample is used research. Sample is study where 35 pregnant mothers who had the TTP above the month of June. From the table, we know that it's about 60%. 60% get support from their husband and 40% don't get support by the husband. Next is the table of about ANC compliance. ANC compliance, it's about 62.9. It's obtain the ANC compliance, and then it's about 37.1% is dissolving ANC compliance. The conclusion, based on the result of study, husband support relationship with antenatal care compliance in pregnant women in primary clinic years 2019, with the number of the 35 respondents. Based on the result of the study.
I'm sorry, Donna. Time is over.
Okay, ma'am.
Okay. Thank you for Donna. Now, we next for the fourth presenter. That is from May Christina Gea. Time is your May.
Good morning, everybody. Thanks for the time to giving for me. My name is May Christina Gea. I will explain about relationship body mass index and physical activity with this method a young woman senior high school 64 Jakarta in 2019. Introduction. The incidence of menstrual pain or dysmenorrhea in the world is very large, and over more than 15% of women for each country experience menstrual pain. The incidence of dysmenorrhea in Indonesia is 64.25% women, consisting of 54.89% experience primary dysmenorrhea and 9.36% experience secondary dysmenorrhea. Dysmenorrhea is gynecological disorder that often occurs. There are some women who feel pain or cramps in the lower abdomen during menstrual distress, and to cause symptoms such as loss consciousness, the pain that is so severe that it cannot withstand the pain. Body mass index is a simple way to activity the nutritional status of adult. Weight loss increase the risk of degeneration diseases. Maintain a normal weight allow a person to reach a low life expectancy. Physical activity in the physical movement carried out by the body muscular and their supporting system. Physical activity is any body movement produced by skeletal muscle that requires energy expenditure. Research and method. Research design is analytic with cross-sectional approach. The population is young woman is in senior high school, 64 Jakarta class 10, and technical sampling is sampling technical total sampling. Distribution frequency. Frequency distribution of respondent based on young woman dysmenorrhea at senior high school, 64 Jakarta in 2019. Young woman no dysmenorrhea as much as 30%. Young woman dysmenorrhea 17%. Frequency distribution of respondent based on body mass index at senior high school 64 Jakarta in 2019. Young woman body mass index abnormal 17.5% and young woman body mass index normal 25%. Frequency distribution of best respondent on physical activity of young women at senior high school 64 Jakarta in 2019. Physical activity low 30%, physical activity medium 49%, and physical activity high 21%. Results and result. Chi-square test result at body mass index and dysmenorrhea obtain p-value 0.000 that there is a relationship between body mass index with dysmenorrhea. Chi-square test on physical activity and dysmenorrhea obtain p-value 0.524 that there is no relationship between physical activity and dysmenorrhea. Conclusion and recommendation, there is relationship between body mass index and dysmenorrhea. Abnormal body mass index caused by malnutrition. Young women should pay more attention to eating patterns and avoid eating fast food. Thank you.
Well, nice. Thank you for May Christina Gea. And the next fifth presenter from Sri Mulyana Putri Bakara. Time is yours.
Okay, thank you, Moderate. Before I start my presentation, I want to inform you that if you have any question for me, you can hit me up on my email because I have just a limited time for my presentation. I introduce myself. My name is Sri Mulyana Putri Bakara. I'm midwife profession education from Mitra Husada Medan College, Indonesia. And then I will make a presentation with my title, The Relationship Between Gravidity and Nutritional Status with Hyperemesis Gravidarum in Pratamaniar Medan Maternity Clinic at 2019. And we will discuss about introduction, method, result, and conclusion. For the first introduction, we know that all women who have get married mostly want to get a pregnancy, but because pregnancy is a normal, natural, and healthy process resulting in physical, mental, social exchange that influenced by physical, psychological, environmental, socio-cultural, and economic factors. But nausea and vomiting occur in pregnancy until the age of 16 weeks. In several vomiting, dehydration, acid baths, and electricity distress, ketosis can occur. This condition is called hyperemesis gravidarum. Okay, based of World Health Organization, the incidence of hyperemesis gravidarum research is 12.5% of the total number of pregnancies in the world, and Indonesian Health Profile, the incidence of hyperemesis gravidarum total in 2016 is 1.5 until 3% of the total. And based of the result on my initial survey at the Medan Primary Health Initial Clinic in January to May 2019, where 230 women are pregnant visited antenatal care in near clinic, and 100 18 them were trimester 1 pregnant women and 54 them had hyperemesis gravidarum. Methods of this research is analytical study aims to determine the relationship of gravidity and nutritional status hyperemesis gravidarum in first and second trimester in pregnant women at Pratamaniar Clinic in Medan City at 2019. Who is the population of my study? The population were of pregnant women who visited antenatal care at the Pratamaniar Clinic in June to July with an estimate gestational age of the time come to the maternity clinic as less than 20 weeks, and with the sample of my research, the sample of the study was a pregnant woman experiences with hyperemesis gravidarum and not hyperemesis gravidarum who visited the clinic Pratamaniar with the number 46 people, and we are divided to two groups with hyperemesis and without hyperemesis gravidarum. As you can see that in my table of results, hyperemesis gravidarum, pregnant woman with hyperemesis gravidarum in with gravidity primi have a 16 or 69.6%, with Skundi gravida is 3% or 13%, and multigravida have 3% or 13.1%, and grande multigravida 1% or 4.3%, and pregnant woman without hyperemesis gravidarum is in primigravida is 3% or 13.1%, and Skundi gravida 7%, 30.4%. Based on the p-value and chi-square result obtained that there is a relationship of gravidity with the incidence of hyperemesis gravidarum in pregnant women in Pratamaniar Clinic, Medan City is p equal 0.002. And the table of nutrition frequency distribution of nutritional status. You can see also in my table nutritional status. Pregnant woman with hyperemesis gravidarum, base of nutritional status malnutrition is 20% or 87%, and good nutritional status 3% or 13%. And then pregnant woman without hyperemesis gravidarum when malnutrition is 9% or 31%, and good nutritional status is 14 people or 60.9%. And then with this side of this result have the p of chi-square is 0.001. Discussion of our study is the result of
I'm sorry.
the relationship between
Sri Mulyana. Time is over. I'm sorry. Okay, thank you. For your presentation. Well, next for the sixth presenter from Dr. Rina Puspita from Palembang. Welcome, Mrs. Well, hello, Dr. Rina. Dr. Rina.
Hello.
Yeah.
Can you hear me?
Yeah. Okay.
Okay.
Well, we start. Time is yours, doctor.
Okay, thank you for the opportunity that you've given to me. Before I'm starting, I'm gonna say thank you for Stikus Mitra Usarat Medan who already give me opportunity to present my research about infertility. Okay, this is me. I actually already have my PhD from program in Medical Science, Faculty of Medicine, Universitas Indonesia in July 2019. Today, I want to present my research about correlation of anti-mullerian hormone and follicle-stimulating hormone in Indonesian polycystic ovary syndrome patient. This is a cross-sectional study. Okay, this is the team that including there is joined me to this research. They're from Department of Obstetrics and Gynecology and Nutrition and Medical Biology, also from Cipto Mangunkusumo Hospital and also from Bunda Medic Hospital, Jakarta.
Okay. Okay, next. Okay, next. For the introduction, infertility affecting 80 million reproductive age couple worldwide. In Indonesia, infertility affecting 21.3% of couples. So fertility in women caused by anovulation cycle is 40 until 75% in case, and 40% case of oligomenorrhea occur due to polycystic ovary syndrome. PCOS is known to be one of the most prevalent endocrine disorder cause of infertility. Hormonal imbalance PCOS manifests as hyperandrogenism and hyperinsulinemia with special negative effect of the correspondent with the severe of PCOS. To the date, until now, the pathogenesis of PCOS is not fully understood. One of the purpose mechanism of hyperandrogenism is follicle maturation abnormality, in which the growing follicles does not progress to the dominant follicle. Follicle maturity depends on the level of follicular stimulating hormones. And then another theory related that anti-Mullerian hormone is found high level, 3 times higher in PCOS women compared with healthy women. Next. Okay, this is causes PCOS that so many factors can cause the polycystic ovary syndrome, such as maternal environment, gain regulation in folliculogenesis, gain regulation in steroidogenesis, diet, gain regulation insulin secretion, gain regulation insulin action that make a luteinizing hormone higher, and finally will make woman become an ovulation, and then will make the woman become infertile. Next, objective of this research is we want to evaluate correlation between anti-Mullerian hormone level with follicle stimulating hormone level in Indonesian polycystic ovary syndrome patients. Material and method, we studied 60 women patients who were being seen for infertile for IVF in Cipto Mangunkusumo Hospital and Bunda Hospital Jakarta. This patient aged 25 until 40 years were divided in two groups, 30 women with PCOS and 30 women with near PCOS or group control. The diagnosis of PCOS was based on Rotterdam criteria 2030. Women in control group participate in IVF program because their partners suffer from infertility. We include patients with Cushing syndrome and medical history of endometriosis. We have this sample from April 2018 to February 2019. Okay, next. Okay, this is Rotterdam criteria that we will diagnose the patient must have 2 from 3 symptoms. Next. Okay, we have ethical consideration for ethical committee of Faculty of Medicine, University of Indonesia in 2018. Next. Statistics analysis, we use independent t-test and using SPSS version 222. Next. From the result, we can see that anti-Mullerian hormone is more higher than healthy woman, and also, but it is contrast with follicle stimulating hormone that follicle stimulating hormone is more decreased in polycystic ovary syndrome. Next, this is so many study that we found this have similarity with our research. Next. Okay. Anti-Mullerian hormone, we found that more higher in polycystic ovary syndrome. Also, we have anti-Mullerian hormone as a cutoff point 949 nanogram millimeter has a cutoff point of anti-Mullerian hormone. Next. Okay, next. Okay, this is correlation. The more higher anti-Mullerian hormone, follicle stimulating hormone will more decrease. Next. Okay, next. Next, this is the picture. Follicle stimulating hormone will make follicles stuck in small antral, cannot grow and cannot mature. That make patient with follicle stimulating hormone will infertile. Okay, next. Okay, conclusion: the higher of anti-Mullerian level in women with PCOS will the lower follicle stimulating level of PCOS. they also declared they no have competing interests. And we thank you for the women who participate in our research. Okay, this is reference we use in our research. Okay, thank you so much for the attention.
Well, thank you very much, Dr. Rina. It's so very interesting presentation.
Okay, thank you so much.
Well, next we turn in the seventh presenter. That is from Sir Jonas Bastian Sely from Citra Bangsa University, Jepang. Hello, sir.
Hello.
Well, welcome.
Thank you so much.
Time is your presentation.
Okay, thank you for the time given to me to present the result of our research. First, I want to send greetings from Kupang for all participants in this seminar. May God always protect all of us, especially during the pandemic season. I will present the result of our research about the effect of addition of white onion extract to beef protein levels exposed with microwave radiation. First, I want to introduce our research team. There are 3 researchers in our team. First, myself as the first author. My name is Jonas Bastian Sely. I'm a lecturer in biophysicists, graduate from Universitas Brawijaya 2015. The second is Mrs. Kade Dwi Ariesti. She is the public health nutritionist, graduate from Universitas Udayana 2015. And the third author is Mrs. Mili Artanedi Jumetan. She's a midwife, graduated from Universitas Tribuana Tunggadewi Malang 2014. Okay. For the background of our research, protein is a macromolecule that functions as a bodybuilder. For pregnant women, protein intake is needed around 75 to 100 grams per day. In addition, during the COVID-19 pandemic, protein intake can increase the body immune, so it is not susceptible to disease. Beef, especially the sirloin, has a high protein content, which is about 27 grams per 100 grams of meat. The process of cooking with high temperatures can reduce protein level, thereby reducing the quality of nutrient in food. Microwave oven is one of the cooking instruments that utilize microwave radiation to produce heat. However, this process has the risk of formation of free radical due to the radiation exposed to food. To counterattack the formation of free radical, we need antioxidant compound. One of the herbs that contain natural antibody compound is garlic or white onion. Therefore, this study was conducted to determine the effect of adding white onion extract to beef protein level cooked using the microwave oven. The material, the design of this research is through experimental research with pre-test, post-test control group design. This research was carried out from January to February 2020 in the health laboratory of Universitas Citra Bangsa. For the sample is 100 grams of sirloin and white onion. For the intervention, we add the extract of sirloin before the cooking using a microwave oven. The temperature used in this cooking process is 150 degrees of Celsius in 8 minutes. This temperature and heating time are chosen to produce a medium well stick level. The test of protein content of meat before after cooking using the Kiedal method. The analysis uses simple linear regression of statistical tests. The results, using a microwave oven, reduced protein content in meat by 22.48%. So we can see the result from the figure 1, beef protein retention control and experiment group. Based on the graph, figure 1, it's known that beef protein retention is reduced to 77.5% when cooked using a microwave oven. Protein retention has increased when given the addition of garlic extract before the cooking process. The highest protein retention was in the sample that were given garlic extract concentration of 100%, which is 90% 0.6. Okay, in this figure 2, the linear curve graph, we can see that the value of the protein is 75.03% when the addition of 1 unit of concentration of white onion will increase protein retention by 3.86%. Then the conclusion of this research is the cooking process using microwave oven can reduce the beef protein content by about 22%. However, the addition of garlic extract at a concentration of 100% can increase the beef protein retention around 90%. The concentration of garlic extract has a positive impact on the retention of beef protein cooked in microwave oven. The higher the concentration of garlic added, the higher the beef protein can retention. Thank you so much. Back to the moderator.
Well, thank you so much, sir. That's so very informative and interesting presentation.
Thank you.
Well, next to the next speaker, next presenter, I mean. Please welcome Mrs. Aisanti Yuliana Paulus from Citra Bangsa University, Kupang. Hello, Mrs.
Hello.
Hello, well,
Okay.
now your time. Okay, please, Mrs.
Okay, thank you. Thank you for the time that giving to me. Now I want to present the result of our research about personal belief on the accessibilities of family planning service to poor couples of reproductive age at Sabu Rejua district. First, I want to say a greeting from Kupang, East Nusa Tenggara Timur, and I want to introduce our team. I myself, Aisanti Yuliana Paulus, SKM MKS EPID, Scientist Field of Public Health, especially epidemiology. And my friend is Mr. Arman Lete, SKM MPH. He's Scientist Field of Public Health too, but he's especially health promotion. We are lecturers at Citra Bangsa University Kupang, East Nusa Tenggara Timur. Okay, the background of our research is one strategic decision from Indonesian government in order to slow the rate of population growth is national family planning program. One common problem regarding contraceptives in the community is the presence of negative perception about contraceptive. More numerous growing rumors or beliefs in the community often produce fear regarding contraceptive use. Accessibility to health service, its main family planning program that health service must be accessible by the community without being hindered by geographical, social, cultural, religious, economic, organizational, and linguistic condition. Based on the data obtained from the National Family Planning Coordinating Agency of East Nusa Tenggara Timur Province, the number of family acceptor at Sabu Rejua Regency has the lowest acceptor coverage. There are no participants in IUD, MOW, and MOP. So we know that family planning program have more benefit. There are suppress the rate of population growth, pregnancy control, and improve the community welfare. Next, many factors can cause a mother or couples of reproductive age to have no access for family planning service. There are first, major knowledge and understanding of family planning programs. Second is physical environment factors such as transportation, distance from home to health facility, and availability of contraception. And the third is socio-cultural environment factors such as belief, existing norms, and the influences of significant others. Okay, next. And all of them can be influenced decision by someone to participate in family planning service. The aim of the research is to figure out the personal belief about the accessibility of family planning service towards poor couples of reproductive age at Sabu Raijua district. The research method type of research is qualitative study with phenomenological research design. The population is all poor couples of reproductive age at Sabu Raijua. The sample is a part of the population and consists is the main informant or participant are poor couples of reproductive age who never use acceptor. And the supporting informant or participant one, the health practitioners, family planning officers, and the community leaders. So we use proportive sampling, and the time of research was begun from April to July 2019 at Sabu Raijua. The data collected by observation and in-depth interview, and the analysis with Miles and Huberman models that began from data reduction, data display, and verification. So the result of our research so that subject of participant in the research were 16 participants, consist of 11 couples of reproductive age who never use acceptor, 2 health practitioners, 2 family planning officer, and 1 community leaders. According to the sex of the participants, so that more women than men, and according to the age range of participants were 24 to 46 years old, and according to the education of the participants were more elementary school and junior high school than higher education. And the result of thematic analysis, there are 2 factors that causing personal belief to access family program. That is internal factors and external factors. From our PowerPoint, see that the personal belief caused by internal factors can be categorized with one. The first is family program was causing that health problems and causing illness, where the
I'm sorry, interrupted, Mrs. You have time 2 minutes again.
Oh, time 2 minutes. Okay. I think you can see in my PowerPoints, but the important is 2 factors causing the personal belief is internal factor and external factors. Yeah. Internal factors caused by there are government program that can finance pregnant women. They stop participating in family program because they got money. There is a government program that can help during pregnancy. Okay, conclusion is personal belief has influenced in the accessibilities of family planning service of birth or birth control method. Belief with influenced by knowledge and personal experience and social relation with others. The recommendation is first, health practitioners has an important role to provide in accurate information and education of family planning and the side effect for the community. Second is, despite of any wrong beliefs about contraceptive and family planning, the community have in place and role into use contraceptive methods. And the last, in intersector collaboration is needed to ensure that success the government programs. Okay, that's all. Thank you for your attention. I back to you, moderator. Thank you.
Well, thank you so much, Mrs. Aisanti. That's a very interesting presentation.
Thank you.
Well, next the presenter from Mrs. Hieronima Niati Fitri from Citra Bangsa University, Kupang. Hello, Mrs.
Good morning.
Hello, Mrs. Hieronima. Can you turn on your video, Mrs.? Hello, Mrs. Hieronima.
Okay, I'm sorry. She is my friend and she can use my video.
Yeah.
Okay, because any problem with this video.
Okay. Okay, welcome, Ms. Hieronima
Thank you.
Niati Fitri. Yeah, time is yours, Mrs.
Ya. Mana PPT-nya? Di sini ya? Di sana. Oke. Citra Bangsa Kupang at Nusa Tenggara. I will present our result of research with my team. Our team, me and Mrs. Kadek. The research title, analysis intake calcium and iron substance in the incident of dysmenorrhea on female adolescents. Next. Halo? Suaranya.
Yeah.
Wow.
Yeah. Can you see the picture, Mrs.?
Yeah. Thank you. Okay.
You're well.
Menstruation is a sign of women experiencing puberty. One problem that is often encountered during menstruation is dysmenorrhea. Female adolescents who experience menstruation pain in carrying out activity, especially learning activity at school. The cause of dysmenorrhea is multifactor, one of which is the intake of nutrients, source of calcium and iron. Calcium plays a role in the process of protein interaction in muscles, namely actin and myosin when muscles contract. Lack of calcium causes the muscles to not relax after contraction, which can cause muscle cramps. Iron is an important element in the formation of red blood cell. Lack of iron intake results in anemia. When a person suffers from anemia, the body's sensitivity to pain will increase. Next slide. I'm of research to analyze the relationship of calcium intake to the incidence of dysmenorrhea in female adolescents. And the second, to analyze the relationship of iron intake to the incidence of dysmenorrhea in female adolescents. Next slide. Material and method. This research is a type of analytic study using the case control method. The independent variables in this study are food intake or calcium and iron source, and the dependent variable in the incidence of dysmenorrhea in female adolescents. The population is female adolescents in Citra Bangsa Senior High School. The research sample of 32 people divided into case group, a respondent, and control group of 24 respondents with a comparison of case group and control group 1 compared 3. Data were collected using a questionnaire and food recall form to determine the intake of calcium and iron source of food consumed by young women or female adolescents. Next. The research time September 2019. Next, result. Characteristic respondent. Most respondents are late teens and have normal menstrual period. There are between 2 until 7 days. Next slide. Yeah. Based on the p-value, so that there is a significant relationship between calcium and dysmenorrhea with odds ratio value of 26.6, which means that female adolescents who have calcium intake of less than 77% have a risk of 26 times higher experience of dysmenorrhea compared that calcium intake greater than or equal to 77%. And then based on the p-value indicate that there is a significant relationship between iron and dysmenorrhea with odds ratio value of 14, which means that female adolescents who have iron intake of less than 77% have a risk of 14 times higher experience dysmenorrhea compared that iron intake greater than or equal to 77%. On this slide, incorrect writing and the meaning of ratio in the explanation below the table. I'm sorry about that. Next. Conclusion. Lack of intake of food source of calcium and iron increases the incidence of dysmenorrhea in female adolescents. The intake of food source consumed every day cannot meet the needs of female adolescents, so that additional calcium and iron intake is needed in the form of supplement. The government, in this case, the health service and related sector, can help to increase the provision of iron tablet and also seek fortification of food ingredient with nutrient needed during adolescence period. Yeah, thank you for attention, and I offer to you, moderator. Thank you.
Thank you very much, Mrs. Hieronima Niati. Although there is trouble network, it's okay, right?
Yeah, I'm sorry.
Okay. I'm sorry. To the next presenter, please welcome Mrs. Marlina Simbolon. Time is yours, Mrs.
Thank you, Mrs. Ratno Wahyuni. Okay, thank you for the time. I will explain our research with my friend Anissa Grananda. The title is The Relationship of the Labor Position with the Success of Second Stage of Labor in Pregnant First on Apriani Midwife Practice in Dumai Riau 2019. Next. Introduction. Childbirth is a process of expulsion from the conception, fetus, and placenta that is quite months or can live outside the womb through the birth canal or through other ways, with help or without help or by own strength. The desired birth position during childbirth will provide many benefits, including reduced pain and discomfort, a shorter period of second stage, fewer perineal rupture, and help in straining, so that the value of Apgar is better. This research used analytic survey design with cross-sectional survey approach. The population in this study were first pregnant mothers who visit Apriani's midwife practice during June, beginning of August 2019. Sampling research using accidental sampling technique. The sampling is done by taking cases or respondents who happen to be available when doing research. The sample in this study were 32 people. The test used in this study is the T-independent test. Result. Based of the result of statistical test using the independent t-test sample t-test obtain p-value 0.127 bigger than 0.05, indicating there is no difference between the two variables. So the hypothesis which states that there are differences in tiled and half sitting position towards the smooth delivery process is rejected. Conclusion. The average value of the smooth time of the second stage of labor in the oblique labor position group was 1.44 hours, while in the half seat labor position group was 1.64 hours, with a difference in the average value of 20 minutes. There is no significant difference between the position of oblique labor with half sitting to the smooth delivery process. With the result of the independent statistical test, the value of P is the same as 0.127 bigger than alpha 0.05. Thank you.
Well, thank you so much, Mrs. Marlina. The next presenter from Mrs. Flora Novita Sinaga. Hello, Mrs.
Hello.
Hello. Yeah, time is yours, Mrs.
Good morning, everybody. Thank you for Ma'am Retno for giving time to me. Introduce myself. My name is Flora from Medan, Indonesia. My presentation topic is the factor which influence the incidence of anemia in trimester 3 pregnant women in the working area of Medan Johor Puskesmas in 2019. Introduction, background. Anemia is the biggest public health problem in the world, especially for groups of women of reproductive age. Anemia in pregnancy affects women's reproduction by reducing blood supply to the uterus and potentially endangering even the death of the mother and fetus. Anemia in pregnancy is a condition where mothers with hemoglobin levels are less than 11 grams per deciliter in the first and third trimester, while in the second trimester hemoglobin levels are less than 10.5 grams per deciliter. Based on World Health Organization, the prevalence of anemia in pregnant women in the world is around 40.1%, and risk as the 2018 data is 48.9%. Anemia affects pregnancy, childbirth, and the fetus. Purpose: to analyze the most dominant factor among the factor of age, parity, ANC, antenatal care visit, established adherence compliance, emesis gravidarum, and maternal knowledge of anemia in pregnant women trimester 3 in the working area of Medan Johor Puskesmas in 2019. Research methods. The research used observational analytic method with case control design. It was conducted at Medan Johor Puskesmas from January until August 2019. The population was 108 third trimester pregnant women. 36 of them were in the case group, and the other 72 respondents were in the control group using total sampling technique. The data were analyzed by using univariate analysis, bivariate analysis with chi-square test, and multivariate analysis with logistic regression test. Research result. The result of the research showed that there was no influence of parity with the incidence of anemia, with odds ratio is a 0.4, 95% confidence interval, 0.2 until 1.084. While risk factor which had significant influence on the incidence of anemia in pregnant women were adherence to take FA tablets with odds ratio is 8.3. 95% confidence interval 3.380 until 20.969. Age with odds ratio is 3.1, 95% confidence interval 1.370 until 7.208. Knowledge with odds ratio is 4.2, 95% confidence interval 1.83 until 10.043. Antenatal care visit with odds ratio is 0.7, 95% confidence interval 1.185 until 6.215, and MSS gravidarum with odds ratio is 4.2, 95% confidence interval 1.165 until 15.362. And the conclusion, adherence to consuming FA tablets is the most dominant risk factor which had the influence on the incidence of anemia in pregnant women. It is recommended that pregnant women to keep nutritional intake, especially foods that contain iron, and consume FA tablets of the last 90 tablets during a pregnancy, and have their pregnancy examined regularly at least 4 times in pregnancy. Thank you. I give to the moderator.
Well, thank you very much for Mrs. Flora. Now, to the next presenter from Mrs. Lastria Simamora. Are you there, Mrs.? Hello, Mrs. Lastria. Well.
Hello.
Okay. I will make your sound loud again.
Yes, yes.
Okay, time is yours, Miss. Time is yours, Mrs.
Well, thank you for your time. I'll present my research. This is my team research is Wahyu. My research about relationship between knowledge and attitude of mother with behavior of supplementary feeding of breast milk for infant aged 5 until 24 months as the Auxiliary Community Health Center Ujung Gading, Julu Village, North Sumatra in 2019. Introduction. Complementary for mother's milk is food that is given to babies over 6 months and additional food to meet the baby's intake. Therefore, mother's behaviors in giving complementary food mother's milk is needed. Methods. The research use is quantitative with cross-sectional design, purposive sampling with a total sample of 62 respondents. The data were analyzed by using univariate analysis, bivariate analysis with chi-square test. Result. From table we can see knowledge category, we can see that good knowledge is 64.5%, and attitude category we can see good attitude 54.4%. Next. For bivariate analysis, we can see relationship of knowledge with behavior. From table, we can see that p-value is 0.010. Next. For relationship between attitude and behavior, we can see that p-value 0.028. Conclusion. There is a significant relationship between mother's knowledge and attitude with the behavior of giving complementary food mother's milk to infant in Ujung Gading, Julu Village, North Sumatra in 2019. Thank you.
Well, thank you so much, Mrs. Lastria. It's so very short presentation, right?
Anytime. Thank you, ma'am.
Well, to the next presenter from Mrs. Adelina Sembiring. Time is yours, Mrs. Adelina.
Thank you, Ma'am Retno. Good morning, everybody. My name is Adelina Sembiring. Now I will presentation my research with the title is Effectiveness of Acupressure to Reduce Vomiting Nausea in Patients Receiving Chemotherapy. Nauseous vomit is the side effect of consuming cytostatic. Commonly found in patients undergoing chemotherapy treatment, it causes discomfort or even patient life quality, and acupressure is believed to able to handle it. You can see this all death of breast cancer and chemotherapy. Next. Escobar et al. 2015, in 19 hospitals in Spain, there were 21.7 of patients who complained of nausea and vomiting, is 16.5% complaint of vomiting when receiving chemotherapy. Escobar et al. 2016, in America, 35 of patients complained of nausea vomiting when receiving chemotherapy. Al-Qadir 2017 in Jordan, it was shown that although patients use anti-emetic therapy, the overall incidence of nausea and vomiting was still high at 71.4% and 57.3%. Jen and Tan 2015 in Turkey said that pharmacological treatment do not completely relieve nausea and vomiting, despite being giving anti-emetic. Nausea and vomiting are still common complaint. Next. The advance, the first is non-invasive, natural, safe, no-cost treatment, and easy to apply without side effect. The second is can be done by the patient himself. And the third is can be integrated into current nursing practice. The last is increase gastric motility and contribute to nausea, vomiting. Next, material and method. Material and method type of research is quasi-experimental, non-equivalent method, pre-test control, group post-test design. The research location and time is in Adam Malik Hospital, May to August 2019. Population and sample, all one-day chemotherapy patient at Adam Malik Hospital, 70 people. Next. Method and collecting data. Preparation phase, the first is acupressure training. After that, ethical clearance. The third is research permit. And then identify research sample. And the last is informed consent. For free test is measuring nausea and vomiting use INVR that has been developed. For intubation is PC6 and ST36, 3 minutes, total 12 minutes. 3 times for treatment and 30 minutes before chemo, 4 hours and the next day. And then for the post-test is the nausea or vomiting was relieved after 48 hours. Next. And then the results is for pre-test control is 71.4% and post-test is first 57.3 and the category is the mild. For the intervention is pre-test is 57.1%. And then for intervention is 97.10%. And then the category is mild. Next. Analysis bivariate use Wilcoxon sign rank tanks. Vomiting nausea control V is 0.640, and then for vomiting nausea intervention V is 0.000. Next. For bivariate analysis, use Mann-Whitney night test. Vomiting nausea, p-value is 0.0000. And then for conclusion is the first provision of antiemetic based on hospital standard is not effective against decreasing nausea and vomiting in patient receiving chemotherapy. And then for the second is giving acupressure and antiemetic is effective against decreasing nausea and vomiting in patient receiving chemotherapy. And the last is there is a difference in the effectiveness of acupressure and antiemetic compared to antiemetic against nausea and vomiting in patient chemotherapy. That's all about my presentation. Thank you.
Well, thank you very much, Mrs. Adelina Sembiring. The next presenter from Mrs. Mediana Sembiring. Are you in there, Mrs.?
Yes, I'm here, ma'am.
Okay, time is yours, Mrs.
Okay, thank you. Give me a time. Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Mediana Sembiring. I'm from Stikes Mitra Husada Medan in Indonesia. This my research and team, Mrs. Rizka Susanti Pasaribu and Miss Imarina Borutarigan. And my title is The Relationship of the Reception with the Use of Rational Medicine on Postpartum Mother in Public Health Center Lobaleng, Kecamatan Lobaleng, 2019. Introduction. Medicine is an important factor in healthcare. These are of drugs that are improvised, infection, unsafe, and also not economic is now a problem in healthcare. The use of vitamin E and E tablet in the case of postpartum, 59%, postpartum infection, 63%, average drug as 3.5 drug per prescription. That of North Sumatra Province Health Office 2017. Research methods. Sorry, this is not qualitative, but quantitative, yeah, no qualitative. Sorry. This type of research, as in the study in analytics, serve with a cross-sectional responsive design that is a design of epidemiology study. The sampling technique in the study was to ask a progressive sampling, unit sampling technique of 65 respondents, and my respondent all postpartum mother after delivery until 45 day or 6 weeks. Yeah. Okay. Research result and discussion. This study product the mass dominal variable related to rational drug as the at Lobaleng Health Center, Lobaleng district, which has specific variable that correspondent to the list of vitamin E and E drug with a significant 0.001, odds ratio 16.644 or 95%. Confidence rate is 10.317.5 until 318.129. Discussion, the best of the result of research that has been correct of product several conclusion has followed. There is a feasible relationship that corresponds to the list of drugs, namely vitamin E, 0.027. There is a feasible relationship that corresponding to the list of drug, namely vitamin E 0.020, and there is a reciprocal relationship that corresponding to the list drug 0.001. The most dominant variable related to relation drug as at Laubalang Health Center. Suggestion. This recommended from placebo doctor and midwife, of course, at that Laubalang Health Center in Laubalang district with prescription in accordance with applicable guidelines and accordance with the standard of the Ministry of Health of the Republic of Indonesia. That's all my presentation. Thank you and good morning.
Well, thank you. Good morning. And the last presenter from, the last presenter from Yeni.
Thank you. Thank you for
Time
the
is yours, Yeni.
Okay, ma'am. Thank you for the time given to me. Good morning, everybody. My introduction, my name is Juni Maria Octavia Jambing, Nursing Diploma Study Program in School of the Heart, Mitra Usada, Medan. The next. Nursing care in elderly with hypertension. The Nursing Diploma Study Program in School in the Heart, Mitra Usada, Medan. Next. Hypertension. Hypertension is the size of the cardiovascular system that is often found in the community. Hypertension can be defined as persistent blood pressure, where the systolic pressure is above 140 millimeter hydrogium and the diastolic is above 90 millimeter hydrogium. In the elderly population, hypertension is defined as systolic pressure of 116 millimeter hydrogium and the diastolic pressure of 90 millimeter hydrogium at present. The death rate due to hypertension in Indonesia is very high. The next, the term hypertension is take English. Hypertension which come for the Latin hyper and tension. Hyper means super or extraordinary, and tension means pressure or tension. Hypertension has generally become a popular medical term for heat. Blood sugar. Blood sugar is the power used by blood pump. For the thread to fight blood pressure tension is very blood. The next hypertension where systolic pressure is equal to or greater than 140 millimeter hydrogium and diastolic pressure is equal to or greater than 90 millimeter hydrogium. And isolate systolic hypertension where systolic pressure is greater than hypertension. Idiopathic hypertension is unknown hypertension. This type of my hypertension is 90% of cases of hypertension often. Hypertension is a complex process of several major organs and systems, including the heart, blood vessels, nerves, hormones, and kidneys. Next, in hypertension, signs and hypertension can be divided into a size system. That means there are no specific in medical nursing. The nursing textbook banner and standard 2000 explain the pathophysiology of hypertension fall in the medical that regulates or control blood person extraction dan extraction collect and the center of the fascinator. The next, the goal of anything positive therapy in reduce in morbidity and mortality and cardiovascular and kidney disease. Because most patients with hypertension special because age late 90 years, 50 years, the get normal systolic blood pressure if normal systolic pressure can be can be if normal systolic pressure relates. The main goal of hypertension therapy is maintain systolic pressure within normal limits. Maintain systolic and diastolic blood pressure less than 140 per 90 millimeter hydrogium is associated with described cardiovascular complication. In patients with hypertension accompanied by diabetes and kidney disease, the target blood pressure is 130 or per 80 millimeter hydrogium. The next, hypertension patient usually dishonor if the disease is not controlled and has caused complication to several vital organs. The most common cause of disease with or without stroke and kidney failure with per organ system. Apart in can be now. Thank you. Thank you, Mom.
Well, thank you so much, Jenny, for your presentation. Well, ladies and gentlemen, now we are come to the question and answer session, and also the committee has collected a few questions from Zoom chat and also in YouTube chat. And I will read the question. For the presenter, are you ready to answer the question? Hello, presenter.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. The first question, this is from a chat in Zoom from Nita Buang Manalu to Mrs. Sri Mulyana Putri Bakara. The question is, as a midwife, this pandemic situation, pregnant women with hyperemesis gravidarum can or cannot come to our maternity clinic. So what we should do with our patient? Please answer the question. Time is yours, Putri Bakara.
Thank you for the great question. I will to answer the question. We can do something to prevent the situation, like make a telemedicine with in WhatsApp group, or for discussing about our patient condition, or with the optional apps like Zoom. We can discuss about our patient condition. We can give health education support and problem solving that she can do by himself or his family in his room. Thank you. I think it's enough.
Well, thank you so much for the answer, Mrs. Putri Bakara. To Nita Buang Manalu, hopefully you are you in there, Nita?
Yes, ma'am. I accept our question from Sister Putri Bakara.
Have you satisfied with the answer?
Yes, ma'am.
Okay, thank you very much. To the next question. This is from chat in YouTube from Putri Yani Sihaan to the speaker, Mrs. Donna Betaria Tampubolon. Are you in there, Donna?
Yes, ma'am.
Okay. The question is, what should husband do so that his wife feels safe or comfort when she wants to give birth? Do you understand the question?
Understand, ma'am.
Okay, time is yours to answer.
Okay, thank you to Putri for the question. I will answer it. The answer is husband support during period of pregnant woman will make sense of comfort and emotional. Husband is one of the keys so that his wife can maintain positive emotional during the pregnancy. So if the husband gives a good positive attitude and a good support to her wife, it can make the pregnancy process enjoyable and until the fetus will be safety and strong. That's it, the answer for me.
Have you answered the question, Donna?
Yes, ma'am.
Okay. Yeah, hopefully she is watched in YouTube and satisfied from your answer, right? And the
Right,
next
ma'am.
question, yeah, thank you. And the next question, this is from Zoom chat from Frafti to presenter May Christina Gea. Are you still in there, Gea? May Christina
ma'am.
Gea? Okay. The question is, what are factors influence physical activity? Just that. Please
Thanks for
answer.
the question from Frasty Swansty. Factors that influence physical activity are the first, lifestyle. Lifestyle is influenced by economy, cultural, family, friends, community status. Secondly, education. Education is a key factor in a health lifestyle. The better education, the better the life of individual health. And the last, bad environment will bring bad effect and vice versa. Thank you, ma'am.
Well, thank you so much for your answer. What
Yes,
about
ma'am.
Prafti? Have you satisfied for the answer?
Yes, ma'am.
Well, thank you so much. Ladies and gentlemen, that's all the questions and the answer from the presenter. Finally, we come to the last session in the first session. And next, before that, I say thank you to Dr. Prina Puspita, Mrs. Hironimaniati, Mrs. Aisanti, and also Sir Janus Bastian Sally for joining with us. Hopefully, in the future, we can build teamwork and also we can join research together, maybe in the next time. Hopefully.
Thank you so much.
Okay. Now we continue to the second session. In this oral presentation, there are 10 presenters. So the second session, the first speaker or the first presenter from Prafti Suwawi. Hello,
Yes, ma'am.
Prafti Suwawi. Yeah. Are you in there?
Ready, ma'am.
Ready. Okay, before we start it, I also remind you again, this presentation only just 5 minutes for our presenter, and also our judges still same with the first session. Is still there Mrs. Lydia Natalia Sinuhaji? Hello, Mrs. Hello, Mrs. Lydia.
Yes, ma'am.
Okay. And the second judge is still Mrs. Lucia Tun.
Hello, ma'am.
Okay. And the third is still there, Mrs. Rilina Pinam.
Okay, I'm ready, ma'am.
Okay. We start again in the second oral presentation, right?
Okay, ma'am.
Okay. Okay, Prafti, time is yours. Please.
Okay, thank you for the opportunity. Good morning, sir, mom, ladies and gentlemen. Okay, I want to introduce. My name is Prafti Suwawi. I'm come from Aceh, Indonesia. And I'm student high school Mitra Usada Health Medan, level 1, semester 2, midwifery. Alright, here I will explain the result of my lesson through the PowerPoint. The title of my presentation is Happy Difference and Long Baby 0 until 6 months that are exclusive asset and MPAC in the village of Hutagalung Parlitan, Humbang Hasurutan in 2019. Okay, background. The baby is the first month of critical leave because the baby will experience adaptation to the new environment outside the womb. Breast milk is the best food for babies during the first 6 months of life or called exclusive breastfeeding. But in fact, before in the
of 6 months, many babies have been given MIHHICo. The study was conducted to determine the differences in weight and body length of infant aged 0 until 6 months who were given exclusive breastfeeding at those who were given MIHHICo at the Hutagalung Health Center, Parlitan District, Humbang, Hasurutan, Regency. Research including comparative research with a retrospective approach. The sampling technique used purposive sampling. Okay, formulation of the problem. Now the difference between weight and length. Length of 0 until 6 months, baby who were given exclusive breastfeeding and to those who were given MIHHICo in Hutagalung Village, Parlitan District, Humbang, Hasurutan, Regency in 2019. Next, special purpose. Number 1, know the characteristic of parents of infants who are given exclusive breastfeeding and to those given by MIHHICo. Number 2, knowing the characteristic of babies given exclusive ASI and the those given by MIHHICo. Number 3, identifying weight gain and length of infant age 0 until 6 months who were given exclusive breastfeeding in Hutagalung Village, Parlitan District, Humbang, Hasurutan, Regency in 2019. Okay, material and research methods. Research this type of research is another foreign body like of baby 0 until 6 months in 2019. Okay, conceptual framework. The conceptual framework is a conceptual model related to how a research constructs a theory or logically links several factors that considers problem. The concept 2, baby works 0 until months, baby 0 until months, population and sample. Population, the population in this study were all infant in 7 until 12 months in the village Hutagalung Village, Parlitan District, Humbang, Hasurutan. Breastfeeding, weight and body length out age 0 until 6 months in this health card KMS are many as 42 babies. Sample, the sample in the study used a total sample technique where other acute population is used as sample. The sample of this study was 42 babies. Result and discussion based on body weight per month can be seen that the weight of infant egg 1 until 5 months showed no difference in body weight, meaning they babies who were given exclusive breastfeeding and MIHHICo had equally good growth. This is because at the age of under 5 months, the growth of vulnerable babies included by factor other than food such than an economic condition. Next, conclusion. Number 1, characteristic of baby parent given exclusive ASI and the those given by MIHHICo tend to be the same based of effects of egg regulation, technicity, occupational education, and parentality. Number 2, the weight gain of fine who are exclusively breastfed and
I'm
afraid
sorry,
of.
interruption, Prapti.
Yes, ma'am.
Yeah, time is over. I'm sorry.
Yes, ma'am.
Okay. I remind you again to this presenter to find a good network so hopefully there is not disruption again. The next presenter from Dwinda Sari. Are you in there, Dwinda?
Yes, I there.
Okay, time is yours, Dwinda.
Thank you, madam. Thank you for the opportunity. Good morning, everybody. Introduce myself.
My name is Dwinda Sari. I'm from Nursing Diploma Study Program High School of Health Science, Mitra Husada Medan, Indonesia. In here, I will bring the material about nursing intervention in management of failing risk in elderly at a hospital. So now we enter the material. The first here discuss what is the elderly. This is a phase of life experience by human. So the longer a person lives, then in line with body age will experience physical and psychological setback. Physically, the elderly will experience a decrease in bodily function, such as a degenerative process. And hereinafter discussed about the characteristic of the elderly will be seen from the physically appearance of wrinkled skin, lack of vision and hearing function, reduced activity, fatigue, thinning and discolored hair, and generally the elderly are susceptible to disease due to a reduced immune system. Furthermore, here according to WHO data in 2020, it states that 22% of the world population is elderly. And the most recent data from WHO, the latest total population of the elderly is in the country is number 1 is Japan, occupies 27% of the country total population. And number 2 is Italy, occupies 23% of the country total population. Is number 3 is German, occupies 21% of the country total population. And number 4 is France, occupies 19% of the country total population. And number 5 is Spain, occupies 19% of the country total population. So, this is prevalence of failing risk Ministry of Health, Republic of Indonesia. This is 55 year reach 49.4%, continue to increase above 65 years and above 67.1. So we can see this rapid increase. And the factor affecting risk of failing, number 1 is gender. Gender usually women experience a decrease in physically condition even more, so because it has menopause. Number 2 is age, affect the risk of failing in the elderly. The older they get, the decrease in physiological condition will increase. And number 3 is muscle strength, will also be influenced by several factors such as biomechanical factor, neuromuscular factor, and metabolic factor related to energy available. And according to Sunario, at musculoskeletal disorder is a cause of disturbance in walking with balance which can result in slowness with movement, which tend to easily shake, and decreased ability to anticipate sleeping, tripping, and slow response facilitas falls. Musculoskeletal factor play a role in the risk of falls in the elderly. And based on the result of research, according to Rohima, about factor related to the risk of falling in the elderly, in the primary service unit of Medan Johor Health Center, so the incidence of risk of falling in the elderly obtained that 46 high risk, 36 low risk, and 18 no risk of falling. And according to Setia Arini, intervention for risk nursing is a series of actions taken in applying the step to maintain the safety of patient at risk of falling by reviewing to more small scale. This is aimed to provide patient safety and prevent failing patient. And so, intervention prevention of failing patient is number 1, but the patient identification bracelet. But the yellow identification bracelet on the patient risk of falling on the patient risk. And number 2, fall bed safety fence, fall prevention sign, yellow or red triangle label on the bedboard, write in on the whiteboard at the nurse station, adjust the height and height of the bed in accordance with procedures to prevent failing patient, and ensure the safety fence of the weight the state attached. And number 3 is MFS assessment or Morphal scale. So this is role nurse is assessment Morphal score or MFS or Humpy-Dumpy Fall scale and educating patient. So nurse often do intervention to the elderly. It was among the first 8-hour handle, trip tandem, physical exercise, anti-slip mat, and balance exercise. So here I attach the form of nurse often do intervention to the elderly. Until here my presentation, I will back to moderate. Thank you for attention.
Thank you very much, Sudinda, for your presentation. The next presenter, Sunita Boang Manalu. Are you in there, Nita?
Yes, ma'am.
Okay, time is yours, Nita.
Thank you for this time for me. Okay, before it, I want to introduce myself. My name is Nita Dewika Buang Manalu. So I have a so about material. The title is Handling of Infection of Virus Corona or COVID-19 in Maternal, Pregnant Maternity and Puerperal. Okay, coronavirus disease 2019 is a disease that is endemic almost all over the world today with the name severe acute respiratory syndrome, coronavirus. COVID-19 infection can cause mild, moderate, or severe symptoms. The main clinical symptoms that appear are fever, temperature 38 degrees Celsius, cold, and difficult breathing. It can also be accompanied by severe sickness, fatigue, malaise, gastroenteritis, and symptoms. Until now, knowledge about COVID-19 infection in relation pregnancy and the fetus is still limited and there are no specific recommendations for handling pregnant women with COVID-19. In the severe case of COVID-19, it is believed that pregnant women have a higher risk of developing severe illness, morbidity, and mortality. Compared to the general population, side effect when the fetus, the form of preterm labor, were also reported in pregnant women with COVID-19 infection. Fatal distress, preterm labor, are found in some cases. In 2 cases, cesarean delivery was performed and testing for SARS or COVID-19 was found to be negative in all examined in infants. Until now, it is also unclear whether COVID-19 infection can pass the transmission route to the baby. Although there are some reports the babies are tested positive for the virus of birth. The researcher records further validation of this transmission, whether it occurs in the womb or postnatal. There are currently no data to get indiscrete risks of miscarriage associated with COVID-19. Case reports from previous studies with the SARS and MIHHICo did not show a convincing relationship between infection and the risk of miscarriage or fetal death in the second trimester. I think until here this presentation. Thank you, ma'am. Back to your moderator.
Thank you very much, Nita, for your presentation. All right, for the next presenter, that's from Siti Nur Fadila. Siti Nur Fadila, are you in there?
Yes, ma'am.
Okay, time is yours, Siti Nur Fadila.
Okay, thank you, moderate, for the time you give me. Introduce myself. My name is Siti Nur Fadila. I'm student in High School of Health Metro Medan. Study of Diploma Program 3. Now I want to presentation my material about case study of gerontic nursing care in family Mrs. M with hypertension in the Kuala Bekala village, Medan Johor Subdistrict, Medan City. The first material is background. Hypertension can be defined as pressure persistent blood where the systolic pressure is above 140 mm hydrogyrum and diastolic pressure above 90 mm hydrogyrum. Hypertension is a major cause of heart failure, referred to as the silent killer, because people with hypertension often don't manifest symptoms. Brunner and Suda 2015. High blood pressure or hypertension kills 9.4 million people worldwide every year. World Health Organization or WHO figures estimate the number of people with hypertension will continue to increase along with an increasing population. In the next 2025, it is projected that around 29% of the world population will be affected by hypertension. Gerontic is the study of aging process that occur in humans at the age of 60 years, Sophia 2014. Diana is someone who has reached the age of 60 years and over. Aging is not diseases, but it is a process that gradually results in cumulative change. It is a process of decreasing endurance in dealing with stimulation from within and outside the body. The second material is methods. The method in preparing this case study is descriptive, which is a form of case study in implementing nursing care in a case using the nursing process approach, and describe nursing care action given to families with elderly hypertension, starting from assessment, nursing diagnosis, intervention, and implementation and evaluation. Nursalam 2015. The third material is result. 1. Assessment. Mrs. M said that she often consumed excise salt, consumed salt fish, and never followed hypertension gymnastics and exercise, and stated that the cause of hypertension were in accordance with Brunner and Suda 2015. 2. Diagnosis. The first diagnosis is that there is a gap between the theories Brunner and Suda 2015. The second diagnosis is acute pain BRD family's inability to care for a sick family. The third diagnosis is in accordance with the theory that obesity, emotional disorders. 3. Intervention. Treat family members by demonstrating relaxation techniques or deep breathing, counseling and motivating families to be able to modify a comfortable environment and utilize health service to overcome the problem of hypertension. 4. Implementation. The implementation of the first diagnosis is in accordance with the theory according to Ridwan Namaridin 2007 in Wijaya and Putri 2013. Implementation of the second diagnosis of acute pain BRD families' ability to care for families who are aware of Mrs. M. Implementation of the third diagnosis, high risks of complication arising from the inability of the family in caring for a sick family in Mrs. M. 5. Evaluation. Family nursing evaluation is a process to assess the success of the family in carrying out their health duties so as to have high productivity in developing each family member. The last material is conclusion. After the authors do nursing care directly to Mrs. M with hypertension in the Kuala Bekala village, Medan Johor Subdistrict, Medan City, several conclusions can be drawn as follows. After an assessment of Mrs. M was obtained that the lack of knowledge of hypertension and the lack of information about one of the diseases that always occur in the elderly. After taking action to care for the family gerontic nursing, Mrs. M can understand the importance of how to overcome the problem of hypertension by using herbal medicines or visiting an available community service center. Health education is an important factor in the application of gerontic nursing care for the family of Mrs. Thank you, ma'am. I beg to moderate.
Okay, thank you for your presentation.
Okay, ma'am.
Next presenter, there is from Putriani Borusihaan. Hello, Mrs. Putriani Borusihaan.
Yes, ma'am.
Okay, time is yours, Mrs. Putri.
Okay. Good morning, ladies and gentlemen. Thank you for moderate. Thank you for the time given to me. Introduce myself. My name is Putriani Borsyan. I am from Institute of Health Science Mitra Usada Medan in Indonesia. And now I will presentation about the relationship of maternal knowledge of the complete basic immunization in infants at the Public Health Center of Kutang Baru, Southeast Aceh in 2019. And the next, the introduction. Immunization comes from the word immune or resistant. Children are immunized, which means be given immunity to a particular disease. The child is immune or resistant to a disease, but not necessarily immune to other disease. Immunization is an attempt to rest or increase the person's immunity actively against a disease, so that when a time is exposed with the disease, will not be sick or only suffer mild illness. And the next background, the first from the introductory survey conducted by researchers obtained it, result from 10 mothers who have babies, there are 8 babies do not get complete basic immunization. So still a lack of knowledge of the importance of basic immunization complete in the baby. And the second, complete basic immunization coverage in Indonesia in the last 5 years has always been above 85%, but has not yet reached the specified Ministry of Health rested target. And the last, analyzing the relationship of maternal knowledge about immunization with basic immunization in the baby at the care center of Kutang Baru, Aceh Tenggara. And the next,
Halo Putri. Halo Putri. Okay, maybe we can next to the presenter next, right? I think there is a disruption network with her. So we next presenter that is from Mrs. Nur Azizah Lubis. Are you in there, Mrs.? Okay, time is yours, Mrs.
okay, sorry.
Okay, I'm sorry. I will explain to my research. This is my title, The Influence of Obesity and Oral Contraceptive, the Incident Hypertension in Women Young Adult at the Puskesmas Malingkar 2019. Introduction. Hypertension is deadly disease and is the third leading cause of the death in Indonesia, and many factors influencing such lack of obesity and contraceptive oral. Hypertension is found in approximately 8% of women aged 20 to 44 years. Obesity is of particular importance in this population. Chronic conditions such as high blood pressure and obesity put women at risk of pregnancy complications. Maternal mortality due to hypertension in pregnancy continues to increase 21.5% to 27.1%. Introduction. Hypertension increased 1.56 billion by 2025, 46% in East Africa and 35% in America. Highest rate is America. Indonesia, the prevalence of hypertension in women is higher than men, is 22.8% for men and 28.8% for women. Data discussed that in the north of Sumatra, the order to 14 with prevalence of 24.7%. The prevalence case of a disease hypertension at Puskesmas Malingkar, the number 3. Research methods, population and sample. Research designed a case control study with a epidemiologic analytic observational approach. Population, a young woman aged 20 until 40 years old who suffered hypertension in Puskesmas Malingkar. Sample, 19 respondents, 48 case group and 48 control group were professionally recruited. Data collect February until September 2019. Objective of the study, to investigate the influence of oral contraceptive and obesity on the incident hypertension in women young adult in the Puskesmas Malingkar. Research methods, data analyze, univariate analyze, frequency distribution, and percentage of its variable. Bivariate analyze, chi-square test. Result, risk factor of hypertension univariate analyze. In the case group, there were 34 people, young adult women who used oral contraceptive more than 5 years, and 14 people who used oral contraceptives more than 5 years. Whereas in the control group, there were 16 people, young adult women who used oral contraception more than 5 years, and 32 people who use contraceptive more than 5 years. Obesity in young adult women showed that a case of a group of 39 people, young adult women who have obese and 9 people who are not obese. As for this control group, there were 20 people, young adult women who have obese and 28 people who are not obese. Bivariate analyze young adult women who use contraceptive pill KB more than 5 years with a chance from hypertension than chose using contraceptive pill KB more than 5 years. That young adult women who are obese at rates of 9 times greater suffering from hypertension than with no obesity. Conclusion. There is a influence of risk factor for the use of oral contraceptive on the incidence of hypertension in young adult women. P-value smaller than 0.001. P-value smaller than 0.005. The use of oral contraceptive that are consumed continually and used beyond and can cause hypertension. Oral contraceptive contain the hormone estrogen and progesterone. If the hormone contained in the blood for a long period of time cause hypertension. Obesity is the most dominant risk factor with incident of hypertension in young adult women. Thank you very much. I will back to my member now.
Thank you so much to Mrs. Nur Aziza. I think it's so very spirit in this presentation, right? Okay, so the next presenter, that is from Savanakat Lao. Hello, Mr. Vinay.
Hello. Hello, we are
Hello.
here.
Well, welcome again, sir. Okay, for the first presenter, that is, I'm sorry if I wrong to read your name. The first presenter, that is from Mr. Tipapon.
Miss.
Hi. Oh, I'm sorry, Mrs. From Mrs. Tipapon,
Okay.
Napat. Is that right?
Yes.
Okay. Time is yours, Mrs.
Hello, everyone. My name is Tipapon Sanyapet. I'm student midwife for 3rd year. I'm from Laos at Savanakat College of Health Science. Today, I will represent pregnant women do not follow antenatal care and give birth at home in community practice. This is map Liansai village. In the picture, they have house of pregnant women, healthcare center, village house, sugar factor, village office, water factory, and school. Objective: present the study of community about maternal and child care and maturity human 15 to 49 years old. Present maternal and child problems that occurred in village for searching about solving plans in community. Presently, Swanakhet College of Health Science has established midwife for 3-year students by letting students practice in real-life community at Liansai village at Pangthong district, Swanakhet province, with the purpose of conducting knowledge, academic ability, and maternal and child knowledge with the following by mentors, health staffs. Community public health responsibility. Community public health staff have provided prevention and health promotion, primary healthcare and transfer emergency case. There is one healthcare center with 4 staff, 4 females, 3 village volunteers, 2 female and at service station. By the survey of reality data at village, the program including population 1,875 people, 847 females, 17 units, 288 households, and the status of maturity women 15 to 49 years old is 525. Pregnant women are 12. After pregnancy, women are 21. Infants between 0 to 5 years old are 167. Study of family that can receive healthcare information and news via social. The first is medical staff is 42.82%, and the second is volunteer 24.03%. Study of family with maturity women, family with 15 to 49 years old is 97.56%, and family without 15 to 49 years old is 2.44%. This is the study of pregnant women. Pregnant 2.28% and unpregnant 97.71%. Study of antenatal care 1 time and 2 to 3 times, more than 4 times, and without exam. Study of maternal risk, level 1 risk, level 2 risk, and no risk. And study of giving birth at health facility. In health facility, 66.66%, and our health facility, 33.34%. Study of maternal reaction after giving birth. Reexamination 38.09%, and without reexamination 61.91%. Maternal and child problem occurred at community. Problem 1. Pregnancy women do not attend antenatal care. 2. Pregnancy women do not take iron supplement while pregnant. 3. Pregnancy women give birth at home. 4. Postpartum women do not re-exam. And 5. Infants between 0 to 23 months do not receive vaccine. Solving plans. General objective 1. To support maturity, women gain knowledge and right behavior. Pregnancy women and give birth safely. Decrease to mortality risk of mother and child. 2. To lower self-giving
Interruption, Mrs.
birth.
Kim Pampon. Your time is over 5 minutes. We give you 2 minutes again, right?
1 minute back.
2 minutes again.
Okay.
Okay.
Or giving birth at home, leading the risk to the mother and child. 3. To promote the service of healthcare. Conclusion. By observing and interviewing community in village, we found that there still have many maturity women cannot access lack of knowledge and self-care practicing that not appropriate with maturity age, including virus prevention vaccine, cannot receive iron supplement, and there still have pregnancy women do not follow antenatal care and give birth at home. Thank you so much.
Well, thank you so much, Mrs. Tipapon.
Yes.
Okay. To the next presenter, that is from Mr. Vinay Chanson Ho.
Kampun, you mean Kampun?
Oh, Chanson Pon.
Yes, Mr. Kampun.
Okay. To the next speaker, that is you, sir. Time is yours.
Okay, we use the same laptop, can we?
Okay. Oh, this is
Yes.
Mr. Armand Ni.
Rồi. Okay, sorry.
Ini. Vinay, bapak itu Vinay. I'm sorry, Sir Vinay. So the next section, the speaker is Armakni Simangipong. Is that right? I'm sorry if I wrong to read your name.
Okay, here is.
Yeah.
Okay.
Okay, time is yours,
Hello,
Mr.
everyone.
Yeah. Oh, come from Sengnala. Okay, thank you.
Yeah.
Please.
Okay. Hello everyone, my name is Kamphon Sangdala from College of Health Science, Savannakhet, Laos. Welcome to presentation, knowledge and behavior on dengue fever prevention of people in Chadan village, Saiputong district, Savannakhet province. Introduction. Saiputong is the 14th area district of Savanakhet province. In 2019, it was 13 outbreak district in Savanakhet, found 16 infected cases in 11 villages, but no more 30 cases. Particularly, Chadan village had 2 dengue infected cases and still no more 30 cases. Therefore, student team is interested in establishing research about knowledge and behavior on prevention of dengue fever in Thadan village, Saiputong district, Savanakhet province. Objective studying knowledge level in dengue fever prevention in Thadan village, Saiputong district, Savanakhet province. Studying behavior level in dengue fever prevention in Thadan village, Saiputong district, Savanakhet province. Independent variable including gender occupation, age, status, education, patent history, income, dengue fever history in the Europe, and family. Dependent variable including knowledge and behavior level of dengue fever prevention in Thadan village. Know about knowledge and behavior level of dengue fever prevention in Thadan village and use as a primary information for public health staff to conduct solving plan in village. This is several research. Population is family leader, one family, one person. Calculate population simple is specific in 100 people. Simple random sampling is random house number. Category of is about 18. Zero shall found that village have prevention knowledge and medium total 79 people equal with 79% in total. Have prevention behavior at medium level. Average score is 2.15. However, there are some questions that village could understand, and in low level, there are 14 of them. Get the right answer required to 14%. For instance, the age of virus carrier mosquito, there 17 participants can write answer equal to 17%, and less behavior including routine salt, vinegar or washing powder intro carrier this under carbonate average 1.51, and behavior of die mosquito net every 3 months average 1.62. Recommendation should explain the research continues and widely to other villages for collecting comparison data. Should every research about this without factor related to knowledge and behavior of population. Thank you.
Okay, thank you for Mr. Kampon Sengdala.
Thank you.
Okay, so the next presenter for Mr. Vinay.
Abang Mi.
Oh, okay. Armangni. Armangni Simangni Fong, right? Is that your name, sir?
Okay.
Okay, time is yours, Mr. Armangni.
Let me a minute, please. Okay.
Good morning, everyone. My name is Mr. Amami. I am nursing student at the Savanakhet College of Health, the Social. I'm so happy to be here. Today, I will tell you some details. Okay. First, egg of snake bites. Snake have two types. No venomous, non-venomous snakes and venomous snakes.
I'm sorry, Mr. Armangni. Can you change your what is presentation? Your share? Yeah. You can next maybe. Next.
Okay.
Okay.
Mask by biting a frank mask from the bites of a snake. Teeth marks are often absent. Okay. Two raw teeth marks from the bites of
I'm sorry,
not
sir. Maybe you can click the enable and editing, and then after that you can show the share screen.
Oh, sorry. And can you see the presentation?
Yeah, but that is not change. Just the title, first aid of snake bite.
Oh.
Just that.
Okay, and sorry, I will try again.
Okay, maybe you can click enable editing. Yeah, okay, thank you.
Okay. Man kuning nam. Rồi.
neurotoxic venom snake of neurotoxin is cobra, king cobra, exhaustive muscle can agape and tongue tie, lippy class, sleepy, droopy, arch, eyelids, amblyopia, light and first grade, begin feel queasy, vomit, hard breathing and those condition progress, low consciousness, be unconscious, paralysis, and breathing too hard, fear. Okay. Hemotoxin venom and snake with hemotoxin is rattlesnake, Trimeresurus, Bunkerus, Phasmus. Toxic will destroy the blood solid and row of wound on us. Painful and progressive and severe at by side neuromuscular paralysis beginning from eyes, facial muscle and oral muscle before progresses to respiratory and generalized fixed paralysis, painful and progressive swelling at by side. Hay primary nursing when snake, the most important thing is to observe the snake's behavior first and then see and this the scar to see if the snake are not poisonous when was the wound on the disinfectant and close the wound if poisonous in case the snake so first provide the first aid and refer to hospital. Okay, what you should do? Retreat to a safe distance from the snake. Try to identify the snake, but do not try to kill the snake. If possible, take a picture of the snake. Stay calm and in control and reassure the victim who may be very anxious. Remove rings, bracelet, watches, and anything that become constrictive if the limb was to swell up. Immobilize the victim and the bite him. Bite him. First aid. One, kill snake and keep it hard down on the horse that are currently with a cord on rope on rope restraint. Give the person lower than the horse. Do not drink alcohol regularly of painful handheld painkiller and medication in the case of if it hard breathing so if breathe do not use more for absorption plus. Thank you very much.
Okay, thank you so much for your presentation, Mr. Armangni. Okay, to the next presenter. Please welcome Mrs. Zuraida. Are you in there, Mrs.? Okay, time is yours, Mrs.
Assalamualaikum warahmatullahi wabarakatuh. I will explain my research with title Experience of a Nurse in Implementing Patient Safety Culture at Sumatera Utara University Hospital. Patient safety becomes an integral part of quality service. Various international accreditation and certification in activities and program have been developed and implemented to improve patient safety in hospital at the national level. The current nursing service paradigm leads to the quality security paradigm of maintaining patient safety constantly and continuously. Besides that, the quality of service must be improved because the better the quality of service, the better patient safety will be. Many incidents related to work area were not reported for fear of being blamed. Reporting is the basis for detecting patient safety issues, being a source of information of health service. In line with the result of research by UN Kim, That incident reporting is influenced by the work environment. The perception of patient safety culture is needed as an encouragement to stop the reporting incident. The Institute of Medicine and the National Hospital Accreditation Standard recommend creating a building safety culture that must be applied in entire scope of the hospital. The patient safety culture is the first 7 safety steps. Nurse are the last health professional and as a provider of care of frontline hospital service in the community have a big role in determining the quality of health service. Healthcare always associated with medical treatment to humans. The application of a patient safety culture is not easy for nurse, although it seems strategic and practical to create a patient safety culture seems simple, but its implementation is not easy and nurses feel challenged. Based on previous research experience, challenge in achieving an effective and positive patient safety culture in health organization include number 1, inadequate organizational infrastructure, inadequate leadership effectiveness, inadequate effort to offset national and international standards, overshadowed the values of team participation. My research is qualitative research with descriptive my research is qualitative research with phenomenological approach. Participant, 15 participant with method sampling, purposive sampling. With criteria participant are number 1, nurse who have worked at USU Hospital for at least 6 months, willing to be interviewed and record her activities during the interview, able to tell her experience with youth so that research information is obtained. The instrument in this research are demographic characteristic questionnaire and in-depth interview with field note. And the transcript of the in-depth interview with participant was analyzed using college approach. And the result in my research, 5 times the emerged from the analysis of interview, interview. Number 1, accomplishment of patient safety goals with the support from the hospital management. Second, information provided about patient nursing care to improve patient safety. Report of patient safety incident. Obstacle encouraged by nurse in implementing patient safety culture, and the last expectation, the nurse implement patient safety culture. And conclusion, the experience of implementing a nurse and the culture of implementing patient safety in hospital requires support from hospital management by fulfilling facilities in form of facilities in infrastructure in implementing patient safety program and with incident of patient safety by creating a positive work environment and safety culture. Thank you. Related itu moderator.
Thank you so much for your presentation, Mrs. Zuraida. To the next presenter, that is from Mrs. Bintang Rotua Magdalena. Are you in there, Bintang? Mrs. Bintang?
Yes.
Okay, time is yours, Bintang.
Okay, thank you for the time that you given to me. Now I have a topic about the effectiveness of applying warm compresses to the release of breast milk during the postpartum period. Okay, Introduce. Unsuccessful breastfeeding includes breastfeeding not coming out in the first days after delivery and the mother feels insufficient in spending on breast milk. And this situation is not solely caused by the breast doesn't produce breast milk, but the physiological condition of the mother that is feeling insecure during breastfeeding. Swelling of the breast occurs due to a breast milk dam that greatly affects the mother in breastfeeding her baby. Breasts are painful, hot, hard, and touch, tense, and swollen that occurs on the third day until 5th day of the puerperium, and this is physiological. Okay, we know breast pain increase on the third day after delivery due to the development of the mammary glands, breast swelling. The smooth process of acid production and expenditure is largely influenced by the factor of lack of frequency of breastfeeding, breast care, physiological and maternal health, and the use of contraceptive. Factors affecting milk production, they are one, dietary factors in which the daily calorie needs of the mother must consist of 60 until 70% carbohydrates, 10 until 20% protein, and 20 until 30% fat. These calories are obtained from food consumed by mothers in a day by Rahayu 2012. Physiological factors where temporal is one phase, they requires physiological changing the role of a mother requires adaptation that must be left. Responsibility increase with the presence of newborn babies. Encouragement and attention of other family members is a positive encouragement for mothers by Suharani 2009. Writing methods, they are pre-experimental research method where research designed two group pretest post-test, and then sampling by consecutive sampling. All subjects who came and met the study criteria were included in the study, namely the number of sample as many as 80 people with inclusion criteria, premature puerperal woman who had breast care and experienced one of the symptoms, namely swelling, pain, and blisters, and nipple and postpartum mothers who have never had breast care until day postpartum. Result and discussion. They are breast warm compresses during breastfeeding will be able to increase the flow of milk from the glands producing milk. Other benefits of warm compresses include they are the letdown reflex stimulation, prevent dump on the breast that can cause breast swelling, improving blood circulation in the breast area. By Sariono, the hormones that have increased during the first trimester of pregnancy are prolactin and placenta hormone, but estrogen levels are still high, so breast milk has not come out smoothly. Estrogen and progesterone levels decrease dramatically on days 2 and 3 after giving birth to a baby, and the hormone prolactin dominates other hormones, so that it can cause the process of secretion of breast milk in postpartum mothers. And then, early breastfeeding can cause stimulation of the nipples and prolactin formed by the pituitary so that breast milk secretion is more smooth. Postpartum mothers who experience breast swelling caused by increased milk production, poor attachment can cause the mother nipples to blister. Delay in early breastfeeding is rare, and there are restrictions on breastfeeding time. Based on the above data, it can be explained that in the group that was given warm compresses, there was increase in smooth milk production, which in theory only 2 respondents became 6 respondents. Few postpartum breastfeeding mothers previously had 3 people to people because of the increase in milk production. Respondents in the group without warm compresses did not experience a modest increase in breast milk production. And the last conclusion, on the adequacy of baby milk in postpartum mothers in Nagarian.
Yeah, time is over.
Okay, ma'am. Thank you.
Well, to the next presenter, that is from Mrs. Asnita Sinaga. Are you in there, Mrs.?
Present.
Okay, please welcome and presentation your material.
Okay, thank you to moderator allow to my presence. Good morning, all ladies and gentlemen who will present the seminar. And now I'll present the result of my research. Before that, I will introduce myself. My name is Asnita Sinaga from Indonesia. Next. Okay. The title of my research, the relationship of tactile stimulation of the
Sorry,
papilla
Mrs.
mammae.
Asnita.
Yes.
Can you make your situation in your room comfort and calm, maybe? Okay, thank you.
Okay. The title of my research, the relationship of the tactile stimulation of the papilla mammae to the progress of labor in the first phase of active at Henny Clinic, Medan City, 2019. Okay. Introduction. Childbirth is the culmination of series of pregnancy process. Many pregnant women feel worried and anxious waiting for the time of birth to arrive. Pregnant women want the labor to run smoothly and can give birth to a perfect baby, but sometimes the labor process does not work properly and cannot deliver normally. Based on data from the Intercensus Population Survey in Indonesia, the maternal mortality rate has decreased from 359 of 100,000 live births in years 2012. And then now, the 305 of 100,000 live births in year 2015. Causes in maternal death are bleeding, 35.2%, and then hypertension, 27.1%, infection, 7.3%, prolonged labor, 1.8%, and abortion, 4.7%, from Indonesia Health Profile 2016. The birth process that use advanced technology and cesarean section, but who would have thought it was stimulus given to papilla mammae or nipples carried out by the husband who is a mother companionship during labor will provide benefits. That is to encourage the release of oxytocin, which will stimulate contraction to become stronger naturally and can help the birth process naturally. Okay, research and method. The type of research used by research is quantitative analytic research with cross-sectional approach. The population is maternity mothers who are the Henny Clinic to find out the effect of tactile stimulation of mammary papilla on the progress of first phase active labor, which amount to 35 women giving birth in April. The sample of this study is a statutory sample take from the total population of women giving birth to 35 pregnant women. Research result. The frequency distribution above can be seen that a relationship of MIHHICo tactile stimulation to progress of labor in the first stage or active phase of 35 respondents. The majority did as many as 23 respondents or 65.7%, and the minority did not do as many as 12 respondents or 34.3%. The frequency distribution above can be seen the relations of MIHHICo tactile stimulation to the progress of labor in the first active phase of 35 majority respondent phase less than 360 minutes. There is 19 respondent or 54.3%, and minority slow more than 360 minutes, as many as 16 respondents or 45.7%. Okay. The real shoot of the analysis of the relationship between tactile stimulation of papilla mammae with the progress of labor obtained that 3 were as many as 16 of 23 people, 45.7%. Of respondents who did tactile stimulation of mammae papilla and rapid delivery of labor.
Okay, I'm sorry,
Will-
Mrs. Asnita. Time is over.
Okay, thank you.
Okay, thank you. For the next presenter, that is from Mrs. Martaulina Sinaga. Are you in there, Mrs. Martaulina? Hello, Mrs. Martaulina. Hello, Mrs. Martaulina.
Yeah, ma'am.
Okay, can you hear?
Okay, ready?
Okay, ready. Okay, time is yours.
Okay, this is my title. The relationship of self-care with blood sugar levels diabetes mellitus patient in Hernal Medan Hospital. Next. Kok yang ini? Bukan ini yang panjang, udah aku kirim. Bisa nggak aku kirim yang balik ya? Aku kirim bisa nggak? Next, a non-communicable disease that have an impact on the quality of human life, one of which is diabetes mellitus, where the disease is a chronic metabolic disorder characterized by an increase in blood glucose or blood sugar levels, which in turn causes serious damage to the heart, blood vessels, eyes, kidney, and nerves. Okay, next. DM does not get a good handle can cause of increased risk of acute and chronic complication. So, the substance is needed to reduce the risk on this complication. The starting point for living a healthy life with diabetes is early diagnosis. The longer person live with undiagnosed and untreated diabetes, the worse the change of the health results. This type of observation analytic study with a cross-sectional approach to see the relationship of self-care with blood sugar levels in patients with diabetes mellitus. Okay, the table characteristics of diabetes mellitus patient in Herna Hospital, November 2019. The study found that most people with diabetes mellitus were aged more than 16 years, 25 respondents or 41.7%, and 38 female respondents or 63.3%, high school or vocational education, 34 respondents or 56.7%, occupational as self-employed or 38.3%, and income more 2.5 million or 61.7%, and long-term diabetes mellitus more than 5 years or 60%. Next. Next. Yeah. The result is supported by the statement of Gusti and Erna, which says that DM is often found in elderly people because a person ages. The physiological function of a person will decrease insulin secretion, resulting in the ability to control glucose less optimal. And according to Irawan, women have a greater chance of suffering from diabetes mellitus, one of which is because of the syndrome of the monthly cycle or the occurrence of postmenopause, which results in the distribution of body fat becoming more easily accumulated as a result of hormonal process that occur. Okay, self-care of patients with diabetes mellitus in Herna Hospital. About self-care carried out by patients with diabetes mellitus in Herna Hospital, the majority had self-care that is lacking as many as 28 respondents or 60.3%. Next. Next. Yeah. Blood sugar levels of diabetes mellitus patient in Herna level more 200 milligram per DL as many as 35 respondents. Okay, next slide. Yeah. The table can be seen that 30 who have less normal blood sugar level are higher than self-care who have less normal blood sugar levels. This is a relationship between lack of self-care with abnormal blood sugar levels with a value of P of 0.000. Okay. Yeah, this study is according with research conducted by Putri in the DM Polyclinic of Sumedang District Hospital, where the level of safe care is the lacking and the receipt conducted by Linda. The majority of respondents have good self-care, and Hidayah state the surveillance is diabetes mellitus in the working area of the Pucang Sewu Community Healthcare Center, Surabaya, a good self-management status in the category of dietary regulation and medication consultant compliance. Next slide. Okay, next slide. Bisa dibaca. Lanjut. Next. Yeah. Okay, thank you.
Okay, thank you very much for Mrs. Marta Ulina Sinaga. And the next presenter, that is from Mrs. Pinta Situmorang. Are you in there? Hello, Mrs. Pinta Situmorang. Okay, maybe there is a disruption connection. Maybe to the next oral presentation. And now we come to question and answer session. And the committee has collected a few questions from Zoom and YouTube too. Wait, I will read the question. The first question is from Lindang to Frafti. The question is, any effects for women who are pregnant but are still breastfeeding? Do you understand the question, Mrs. Frafti?
Yes, ma'am.
Yeah, you can answer, please.
Okay. I want to question for Lindang. An answer, actually, pregnancy and style breastfeeding are okay, but you should also look at the age of the toddler. If their older brother is over 1 year old, it is better if he is prepared for the weaning process. This will last for 2 until 3 months. In addition, the state of the mother who is pregnant actually makes the condition of the breast prepare for the fetus. So the composition of breast milk will change and usually stop at 4 until 5 months of gestation. So it is better for pregnant women to prepare for the fetus in the womb. Ready, mom?
Okay, thank you for the answer, Mrs. Prafti. To the next question. This is from Mrs. Sri Mulyana Putri Bakara to Mrs. Tim Pampon from Savannah College. Okay, the question is, can you hear me, Mrs. Tim Pampon?
Yes.
Yes. The question is, she in your PowerPoint that there's many pregnant women do not attend antenatal care. So what you should do for that? Okay. Can you understand the question?
Yes,
please?
understand.
Yeah. Okay, please answer.
Yes. So establish healthcare even to the target groups for the understanding and access healthcare knowledge, results, and strengthen health staff providing health service at community health facility for more safe and follow service statistic and results. Thank you.
Okay, thank you for the answer, Mrs. Tim Pampon.
Thank you.
Okay, so the next question.
Thank you.
Wait a moment. Yeah, there is suggestion from Mr. Umar Jamil, PhD from Pakistan. Hello, sir. He gave what is question to Prof. T. People say that if not eating salt for 14 years, then there will be not effect of snack. Is that true? And reason, please. Oh, I mean, this is the question to what is from Savannah Ketlau about snack. I forget. I mean, the question is from Umar Jamil. from Sir Umar Jamil to Kamfom Sengdala. I'm sorry, for Armangmi Simangnifong. The question is, people say that if not eating salt for 14 years, then there will be not effect of snack. Is that true? Reason, please. Can you give the answer?
บอกกินเกลือ40 ปีที่จะตอบว่าsorry ก่อนไหนมาเราถามภาษาอังกฤษ I have not think about this. I will thank you.
Okay. While we wait the answer from Mr. Armangmi Simanifong, I think I can continue the next question. This is from Bintang to Nita Boang Manalu. The question is, are you still in there, Nita Boang? Nita Boang? Okay, I think she is not here. We continue to Mr. Armangmi. Is there the answer?
Yes.
Okay,
I
please.
have not. Think about this. I will say out about this later. For
Thank you for action.
thank you for
Okay, thank you. Say thank you.
thank you.
Okay, thank you for the answer, Mrs. Armangmi. I think you maybe will be find the reason that is true or not, like that. Okay, to Mr. Umar Jamil. Okay, maybe time is over for the second oral presentation session. Now we next to the third oral presentation. Now we next to the oral presentation, the third. The first presenter, that is from Destin Murnianti Raha. Are you in there, Destin? Okay, maybe there is disrupting. Oh, hello, Destin. Maybe you can check your sound. No, we cannot still hear your voice in here. Okay, maybe you can change your phone maybe to another, all find to a good connection. So you can in the next presenter. Okay. We next to the presenter, the second presenter. That is from Mrs. Pinta Situmorang. Hello, Mrs. Pinta Situmorang, are you in there? Okay, maybe still not connected with us. So the next presenter, that is from Desi Malau. Hello, Desi Malau.
Yes, ma'am.
Okay, now your presentation time is yours.
Thanks for the moderator to give me time. Let me introduce myself. My name is Desi Kristina Damiani Malau, Bachelor of Midwifery. Now I want to explain about my topic, and the topic is the effect of extension of pregnant women's knowledge and attitude about hypnobirthing. Introduction. Pregnancy and childbirth are carrying friction that cannot be spared in a normal woman's life. When we prepare to body, mind, and spirit, the process of pregnancy and childbirth can take place safely and comfortable. However, not a few mothers experience childbirth problems and even deaths of mothers and babies. District or City Health Corporate report the number of maternal deaths in 2016 was reported as many as 239 deaths. Based on the result of the maternal mortality rate and infant mortality rate conducted by the North Sumatra Provincial Health Office with the Faculty of Public Health of the University of North Sumatra in 2016, it states that the maternal mortality rate in North Sumatra is 268 per 1,000 live births. Based on this estimate, the maternal mortality rate has not decreased significantly until 2016 year. In general, pregnant women experience psychological burdens such as anxiety and fear both during pregnancy, during labor, and after childbirth. Pregnant women who experience physical disorders cause increased production of stress hormones such as adrenocorticotropic hormone, cortisol, catecholamine, endorphin, growth hormone, prolactin, and luteinizing hormone or follicle stimulation hormone. The release of stress hormone results in systemic vasoconstriction, so that oxygen delivery into the endometrium is disrupted and results in weak uterine musculus contraction. This even causes the process of labor, so that the fetus can experience gravity or fetal distress. One of the efforts to mention uterine contraction during labor using hypnobirthing techniques. What is hypnobirthing? Hypnobirthing is one of the techniques of auto-hypnosis, which is a natural effort to instill positive intention or suggestion to the soul or subconscious mind in undergoing pregnancy and childbirth preparation. If a pregnant woman can enjoy the beauty of pregnancy and the smooth delivery process. The benefit of hypnobirthing, number one, can reduce anxiety, tension, and pain during labor. Next, reducing and even elimination the need for medication to dispel pain and anesthesia. Next, when used for analgesic anesthesia or sedation in the process of childbirth, hypnosis is absolute safe and harmless. Next, significant increase the speed and ease of labor, including shortening the first phase of labor to several hours. Research methods. Each quasi experiment with design one group pre-test on post-test design. The population in this study were all pregnant women visit the Pratama Vina Clinic in Medan in January until June 2018 years. The sample in this study were 40 people. Result the study is number 1. The results showed that respondents know about hypnobirthing before giving intervention counseling or pre-test. Most knowledgeable less as many as 19 people, and at least knowledgeable as many as 5 people. The attitude of respondents about hypnobirthing before their intervention by providing counseling or pre-test at the most negative attitude as many as 26 people, and at least positive as many as 14 people. Number 3, the knowledge of respondents about hypnobirthing after intervention by providing counseling or post-test at most knowledgeable not as many as 19 people, and at less than 6 people, an increase in respondents' understanding of hypnobirthing. Number 4, respondents' attitude about hypnobirthing after intervention by providing counseling or post-test, the most positive attitude were 21 people, and the rest were negative 19 people. The change in respondent attitude about hypnobirthing in good direction. Conclusion, there was an effect of counseling on the knowledge of pregnant women about hypnobirthing, and there is an influence of counseling on the attitude of pregnant women about hypnobirthing. Thanks for your attention. I come back to moderator. Thank you.
Okay, thank you for your good presentation, Desi. To the next presenter, please welcome Oni Ulima Sinurat. Are you in there, Oni?
Yes, ma'am.
Okay, please your presentation.
Thank you for the time that given to me, ma'am. Let me introduce myself. My name is Oni Ulima Sinurat. I'm from the 3 Diploma of Nursing students. The title is The Adult Recurring Nursing Center, Perception of Nursing Profession Students. The growth of the elderly population of Indonesia experienced the largest growth in Asia, namely 440%, Thailand 337%, India 242%, in China 220%. This figure is a significant amount if efforts are not made to improve the welfare and health of the elderly science now, because the elderly have some health problems starting from the deterioration of body cells, so that the function and endurance of the body deteriorates and risk factors for disease also increase. Frequent health problems experienced by the elderly is malnutrition, balance disorders, sudden confusion, etc. The discussion of this study will show the result regarding students' perception about the perceptions of nursing profession students in providing nursing service at the Adult Recurring Nursing Center. For students who have joined the Adult Recurring Nursing Center, they feel that the activity carried out are important for the elderly and provide benefits to improve quality of health and quality of life of the elderly. Food exercise are quite easy and only require a short amount of time, making the elderly interest to do it regularly again at their respective homes. Well, counseling given can increase the knowledge and understanding of the elderly related to the disease they suffer, so that the elderly can control their behavior in implementing a healthy. This research is a qualitative research with a phenomenological approach. The research instruments in the forms of interview guidelines and voice recording device, data collected by in-depth interviews, data separation included in participants 5. The data were analyzed by the College method by determining keywords, coding, and themes from the transcript script. 1. Demographic data. The total number of participants in the study were 5, in which all participants were women, aged 22 until 24 years and had completed the community preparation stage. One, research participant demographic data. Data analysis result. In this study, found 5 main themes that describe the perceptions of nursing preparation students in providing nursing service in the Edo Recurring Nursing Center. Normally, one, Edo Recurring Nursing Center is a place to improve health and a means to provide education for the elderly. Two, Edo Recurring Nursing Center activities benefit the elderly. Three, new atmosphere, variety of activities, and different facilities available at the Edo Recurring Nursing Center. Four, students can learn to become health educators, food fitness facilitators, and health check on the elderly. Five, students apply therapeutic communication to the elderly directly. And the last, the conclusion is the presence of the elderly recurring nursing center is felt to be very beneficial for students in applying skills and as a place for channeling ideas related to the elderly program so as to make students feel enthusiastic and be happy joins. After here my presentation,
Okay, thank you to present your presentation, Mrs. Oni. To the next presenter, that is from Lindang Tumanggor. I'm sorry, Mutiara Asia Putri. To the next
Thank you,
presenter.
ma'am.
Okay, please welcome.
Thank you for the time. My name is Mutiara Asia Putri. I'm come from Universitas Mitra Medan College, Indonesia, and I'm present about effect to reproductive health information service during the pandemic COVID-19 by Mutiara Asia Putri. Next, ma'am. Next, ma'am. I'm about to explain the definition of reproductive health, about to explain the scope of reproductive health in the cycle, about to explain the reproductive right. This study is improve the reproductive health during the pandemic COVID-19 by providing IC service the community and maintaining the quality of health live for the community. Next, ma'am. Next slide, ma'am. How important is reproductive health information? Health is human right that must be provided in any situation, including the current pandemic COVID-19 disaster situation. Likewise, reproductive health is part of health. Therefore, reproductive health service must be available in current disaster situation. The right to reproductive health can still be provided during disaster. The effective population must have access to reproductive health information and service. Next slide. Definition of health in reproduction. Health is healthy condition physically, mentally, spiritually, and socially that enables everyone to live productively, socially, and economically. Reproduction is a process of human life in production of offspring for the sake of survival. Next, ma'am. Next. 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 How do we do that health reproductive health is maintained? One, use contraception during sex. Two, one, risk sexual activity with new people. Next. See, notify your partner if you suddenly show symptoms. Next, doing telemedicine by counseling one first. Next. Next, ma'am. The scope of reproductive health, maternal and newborn health, family planning, prevent and control of reproductive infection, prevention and management of abortion complications, adolescent reproductive health, prevention and treatment of infertility, cancer in the elderly and osteoporosis, pressure other aspects of reproductive health such as cervical, cancer, fistula, and others. offers the scope of reproductive health in several phases of life: conception, infants and children, teenager, fertile age, and old age. Next slide. Next slide. Okay, next slide. Individual reproductive rights. Individual reproductive rights are the rights possessed by everyone, both men and women, or regardless of difference in social class, ethnicity, age, and religion, who decide fairly and responsible to be self, my family, and society regarding among child, decision between children, and determining the time of birth of a child and about to give birth. Okay, thank you. My presentation. Back to moderator.
Okay, thank you for the presentation, Mutiara Asia. So the next presenter, that is from Destin. Are you in there, Destin?
Yes, ma'am, I'm here.
Okay, that is a good connection, right?
Yes, ma'am. I'm so sorry.
Okay, time is yours, Destin.
Well, thank you for the time that you have been given to me. Well, my topic is the effectiveness of ginger in dealing with trimester 1 hyperemesis gravidarum in pregnant women. Introduction. Pregnancy is a gift that is so coveted for a woman. Every pregnancy is a natural process. Pregnancy affects the mother's body as a whole by causing physiological changes that occur throughout the organ system. Most of the changes in mother body are mostly caused by hormonal work. About 50 until 19 of pregnant women experience complaints of nausea and vomiting. These complaints are usually accompanied by hypersalivation, headache, flatulence, and weakness in the body. These complaints are generally known as morning sickness. Here, a complementary therapy using by herbs that can be used to reduce nausea and vomiting during pregnancy is ginger. The pharmacological function of ginger, one of which is antiemetic. As we know, antiemetic can reduce nausea and vomiting. Ginger compound as the main ingredient in the ginger rhizome is a strong oxidant that is effective in treating inflammation. Ginger has antiemetic and anxiolytic activities. This can also help morning sickness. My method and my team write with the method literature. The main types of reference used in literature studies are books, journals, and websites or scientific articles relating to the discussion. The data analysis technique in the form of argumentative description. Result and discussion. As we know, hyperemesis gravidarum is a state of excessive nausea and vomiting, so that daily work is interrupted and general conditions becomes worse. Based on researcher assumption that ginger can prevent nausea and vomiting because ginger is able to be a barrier to serotonin, a chemical that can cause stomach contraction causing nausea. Frequency of distribution of nausea and vomiting. Before use ginger, mid vomiting nausea no frequency, but medium-sized nausea is 11 frequency that is so great. And then after use ginger is 9 frequency vomiting, and medium-sized nausea only 2 frequency. The conclusion of our result is the result of 11 respondents showed that the effectiveness of ginger stay water giving against in the intensity of vomiting in first semester pregnant woman is very effective in reducing the frequency of nausea and vomiting in first semester pregnant woman. I think that's enough for me. Terima kasih, Hopchai Maraba, thank you. I give to the moderator.
Okay, thank you very much, Destin. That is so very informative presentation, right? So the next presenter, please welcome Lindang Tumanggor. Are you in there, Lindang?
Yes, ma'am.
Okay, please present your material.
Thank you, moderator. Introduce myself. My name is Lindang Tumanggor. I am from Dolok Sanggul. I am University Stikas Mitra Usada Medan in Indonesia. Okay, I will explain the material about nursing care for clients with bone metabolism disorders, osteoporosis. The next, ma'am. Aim objective, nurse duty in treating osteoporosis patient to reduce of occurrence of a decrease in total bone mass. Material method is osteoporosis is a disorder in which there is a decrease in muscle bone. There are changes in bone homeostasis. Normal, the speed of bone respiration is greater than the speed bone formation, resulting in decrease in total bone mass. Bones become easily fractured with stress that won't cause in events of normal bones. Conclusion. Next, ma'am. Conclusion. This does not traces a valid state but traces elimination. Insufference get knowledge about osteoporosis and treatment programs. Keywords: nurse intervention, elderly, bone pain patient. Introduction. The next, ma'am. Next, ma'am. Introduction. During this osteoporosis, synonymous with parents, but the fat bone loss can affect ion, including at young age. Recent research from the International Osteoporosis Foundation able briefly that 1 in 4 women in Indonesia with a risk of 50 to 80 years have a risk of osteoporosis, and also weakness of osteoporosis of women in Indonesia is 4 times higher that of men. Material and methods, type of quantitative research, analytic disease with cross-approach sectional, namely assessing primary death. Population from the study are women in the premenopausal period between the ages from 40 to 50 years. The next, ma'am. Results. The results of this study I will describe the frequently distribution of the age respondents characteristic in premenopausal women, factor affecting bone reduction in elderly. Both of the indicate or response to work mechanics. Heavy mechanical loads will cause muscular musculus and also large bone mass. The next, ma'am. Discussion. Next, ma'am. Discussion. Nursing process, assessment, health promotion, identification of individuals at risk, osteoporosis, and the discovery of problem associated with osteoporosis from the basis from nursing assessment. Problem mobility and breathing can occur due to change in posture and muscle weakness. Constipation occur due to inactivity. The next, ma'am. The next, ma'am. Next, ma'am. Nursing intervention, understanding osteoporosis and action programs. Teach the client about the nursing factor, occurrence of osteoporosis, advise adequate diet of calcium supplement, advise accurate the elderly to continue to need calcium, vitamin D, sunlight, and adequate exercise minimize the effects of osteoporosis. The next, ma'am.
Okay, I'm sorry to Mrs. Lindang. Time is over.
Thank you, ma'am.
The presenter. The next presenter or the sixth presenter that is from Pinta Situmorang from Germany. Hello, Mrs.
Yeah.
Hello, Mrs. Pinta. How are you?
I'm fine, thank you.
Fine. Guten Tag
I have
or
a
Guten
problem.
Morgen for now in there? Yeah, hello, Mrs. In Germany, now morning or on afternoon?
Morning.
Morning. Okay, Guten Morgen, right?
Yes.
Yes. Okay, please welcome to your presentation, Miss.
Yes. Okay. Good afternoon, everybody. Guten Tag, alle zusammen. Yeah, let me introduce shortly. My name is Pinta Situmorang, live until now in Bayern, Germany. I am a student of nursing, especially elderly people. I work at geriatric station. And now I will show you my presentation. I'm starting. And the title is Nursing Care of Elderly People in Stationary Retirement Home during COVID-19 pandemic in Germany. Genau. The term of coronavirus, known as COVID-19, has various impacts, negative and positive, on human lifestyle, especially for the elderly who are at risk of getting infected by coronavirus. And in Germany, the government instructed lockdown as coronavirus pandemic started from the middle of March 2020 to the present, with some restrictions because of the risks of infection. Now, and I will show you this. There is a national statistic of Germany coronavirus by RKI, Robert Koch Institute. Now, vertical, there are numbers, and horizontal for age group. As you see, from age 20 to 49 is the highest infection rates, and children up to 10 years, the lowest impact, have the lowest impact. So Corona doesn't have a big impact on children. Next, ma'am. You know, and now the number of COVID-19 cases in Germany started from June 23rd, 2020. The number of infection is 190,862, and the number of new infection on last 7 days, 175,649. And number of deaths is 8,895. Next. Genau. In fact, based on statistic, the number of infections over the age is the highest. The influencing factors are usually caused by a weak immune system. In old age, pre-existing illness, hereditary disease, immune, bad life. Special, no. Genau. Special attention and action are needed on how to prevent the increase of deaths due to COVID-19, especially for the elderly. For example, in Germany, the elderly are not only living and being cared for at home, but also in several health agencies, such as the stationary retirement home. And next. I will give you the adaptation and precautions during COVID-19 pandemic, especially at stationary retirement home. That's for the first visiting ban, or in Germany, Besuchs- und Betretungsverbot. Okay, visiting ban is the first step that is immediately implemented to prevent contamination and spread of the virus from person to person. Doctors, family, friends, and other medical teams. It's mean no doctors, no family. Next, personal protection, mouth, nose protective masks, must be worn during work. On using hand disinfection, much of the infection is transmitted through hands. After treating the wound, bath the patient, catheter, or medicine, always disinfect the hands. Or next, 12 hours service is from 7 a.m. to 7 p.m. and 7 p.m. to 7 a.m. So there's only two shifts, morning to evening and nights, and the same nurse will work 4 days in a row, then 3, in order to reduce contact with other people. And the next. On keep distance and stay in your working area, as a must maintain a distance of 1.5 meter to 2 meters, limited to maximum 5 people in a small room, and are prohibited from entering other work areas such as kitchen and other workstation. Stay in your own room. When a patient is suspected of having a symptom or is just discharged from the hospital, the patient will be isolated from 14 days in his own apartment, and nurses must use complete protective equipment for viruses when they enter a patient's room. The point is risks of infection and positive and negative impacts of changes that have been undertaken during COVID-19. First of all, if positive impacts for nurses get additional payment from government around 300 to 500 euro, especially Bayern. Off work maximum 5 days, unpermitted of having breakfast, lunch, dinner when work, productive working environment, and for patient, relaxed and calm environment, longer time to rest and building good relation with other nurses. And then negative impacts for nurses. There is 2, longer working time, lot of work due to the lack of labor, time pressure, overtime work, and social distancing. And for patient, family visiting are forbidden, getting bored easily, this, of course, on danger of withdrawing on greater stress level. And next, to the conclusion, as elder people above 50 years old are at risk of getting infected by coronavirus or COVID-19. Government and health agencies have undertaken some actions to prevent the spread of coronavirus, and people must adapt themselves with new habits which are completely different from what we do before. It will change our social lives, work environment, and interactions with other people. And that's all. That's my experience during Corona-19. Thank you for your attention. Dankeschön.
Dankeschön. Okay, thank you for your presentation, Mrs. Kim. We continue with the presenter, yeah. Okay, to the next presenter, please welcome Mrs. Isyasari Sembiring. Are you in there, Mrs.? Yeah, hello, Mrs. Isyasari Sembiring. Hello, Mrs. Isyasari.
Hello.
Okay, please welcome to give your presentation, Miss.
Okay, I'm ready.
Okay.
Thanks for your time giving for me. Assalamualaikum warahmatullahi wabarakatuh. Good day, ladies and gentlemen. I hope you have a good condition and happy. I will introduce myself. My name is Yosari Sembiring. No, I will present about different in rote motoric development, language, and prosocial behavior in children who kindergarten program full day and regular. Children, as the next generation and future manager of the national, need to be prepared early on through the fulfillment of their rights, namely the right to life, grow, develop, and participate appropriately in accordance with human dignity, as well as get protection from violence and discrimination. As mandated in the Constitution number 23 of 2002, and target Sustainable Development Goals or SDGs is quality education in 2030 ensure that all girls and boys have access to quality early development, care and pre-primary education so that they are ready to enter primary education. Kid development have a three: rote motor development, language development, prosocial behavior, education learning, early childhood education program or kindergarten, full day program, and regular program. Next. Development is expansion the development stage of complexity from the lower to the higher, increasing and expanding one capacity through growth, maturation, and learning. Rote motor is a body movement the useless musculus or mouth or all member of the body that affected by the child on maturity. Speech is a form of language that use articulation or word used to convey intent. Language development is language development from of language that use articulation or word used to convey intent because talking in the most effective form of communication. Prosocial behavior is any voluntary behavior that is sought to help another in line with previous research put forward by Hammond regarding prosocial behavior of early childhood includes such as sharing, helping, entertaining, and working together. Early childhood education program or kindergarten, full day program, and regular program. Early detection of growth and development of children, questioning development question on and observation state. Next. Research method. The kinds of research is mixed method, sequential explanatory design, location of research, school and daycare, focus family, population and sample, quantitative research, have a respondent for group, and child from regular program. Qualitative research, headmaster of Focus Family, teacher, parent have Focus Family Day program and regular program. Next. Method of collection data, qualitative research, data collection, technique in qualitative research, conducted at the school and daycare Focus Family to access the development language using PPSP and make observation using observation sheets to access prosocial behavior. Quantitative research, data collection technique in qualitative research were carried out in the second stage of research. Qualitative data collection was by FGD, focus group discussion, conducted on key informant who had been determined to be the sample. namely school leader, teacher, teaching staff, and parent of students at school and daycare hocus-pocus family, whose implementation is carried out by sample people. Quantitative result. The difference of TK group, kindergarten group full day, and kindergarten group regular assistant rote motor and language development is development in children who are studying kindergarten full day program is better than children who are undergoing kindergarten regular program. Difference between TK full day group and regular group towards pro-social behavior is better than in children undergoing regular program kindergarten learning. Next. Qualitative research result. Constraint, effort, expectation, and benefit of the implementation of kindergarten learning program full day and regular program against difference in rote motor development, language, and pro-social behavior is contractions. According to the informant, the Abstrac we found in implementation the kindergarten learning, effort, expectation, and benefit. According into the informant, they hope in running a full day regular program is to improve the quality of gross motor development, language, and pro-social of children. Next, conclusion. Based on data on group motor development, language, and pro-social behavior, it's found that most children undergoing full day kindergarten learning have high gross motor and language development or exceeding their age and high pro-social behavior. Based on data on gross motor development, language, and pro-social behavior in children undergoing kindergarten, learning regular program have gross motor language development and normal language or according to their age and moderate pro-social behavior. Based on data on gross motor and development, language, and pro-social behavior, there is a significant comparison in children undergoing full day and regular kindergarten program. Thank you for attention. Thank you. I back to moderator.
Thank you so much for your presentation, Mrs. That's so
You're
very
welcome.
nice. Okay, to the next presenter, please welcome Mrs. Eva Ratna Dewi. Are you in there, Mrs.?
Yes, I'm here.
Okay, please present your material.
Okay, thank you for moderate. My name is Eva Ratna Dewi. I will explain my presentation about the relationship of pregnant demographic knowledge on physiological change on trimester 3 with insomnia occurring in the clinical medan. Background: women portray themselves as emotional surrender, passive, subjective, and physically weak and have a sex drive that change. Hormonal instability that affects women's feeling and emotion has become a stereotype that has been developed in society so far that women are weak and unstable. In the third trimester is often called the waiting period with full vigilance. In this period, the woman began to realize the presence of the baby as separate being, so she becomes impatient waiting for the presence of the baby. There are feelings of anxiety remembering the baby can be born at any time. This makes him watch while watching and waiting for signs and symptoms of labor to appear. According to data from the National Sleep Foundation survey, 78% of pregnant women in America experience sleep disorder, while the result of Kager study 2012 in France states that 75% of pregnant women experience sleep disorder. 97% of pregnant women in the third semester experience sleep disorder. Disorders that are often experienced by pregnant women are discrete in sleep duration. Based on the initial survey conducted at Debbie Clinic, 10 pre-midwifery trimester 3 pregnant women obtained. There were 3 pregnant women who were well informed about a physiological change in trimester 3 and 7 people who lack knowledge of physiological change. Insomnia is caused due to discomfort such as anxiety with cause. Emotional disturbance, anxiety before delivery because the mother has never experienced pregnancy and childbirth before. Based on the description about the other are interested in conducting research with the title Relation Knowledge of Pre-Midwifery Pregnant Women about Physiology Change in the third trimester with the incident of insomnia in Devi Medan Clinic in 2020. Hypothesis: there is a relationship between the knowledge of pre-midwifery pregnant women about physiology change in the third trimester with insomnia in clinic Debbie. Conceptual framework, independent variable, knowledge of pre-midwifery trimester 3 pregnant woman, 1 knowledge, 2 age pre-midwifery, 3 education, 4 occupation, and 5 research. Variable dependent insomnia accident. Method studied about observational with cross-sectional population and sample. Population, this study were all trimester 3 pre-midwifery pregnant women in the Debbie Clinic in 2020, totaling 32. Data collection, primary questionnaire, validity and reliability test, 10 all trimester 3 pre-midwifery pregnant women in clinic Sari. Data analyze, univariate analyze, frequency distribution of respondent on each variable. Bivariate analyze, chi-square with 95% confidence level, p-value less than 0.05. Result, based on the table from 12 respondents who have good knowledge, mother who answer the occurrence of insomnia with yes answer were 1 respondent, 3.1%, and those who answered no insomnia were 11 respondents, 34.4%. While from 20 respondents, those who did not know well were known to mother who answered insomnia with yes answer to 19 people, 59.4%, and those who answered no insomnia were 1 respondent, 3.1%. Chi-square test is a statistical test conducted on 2 variables that are thought to be related to find out whether there is a relationship between these 2 variables. Discussion. After conducting research on 32 respondents, namely knowledge of pre-midwifery pregnant women about physiology change in trimester 3 with the incident of insomnia in Debbie Clinic, Medan in 2020 can be discussed as follows based on the result of the chi-square test. So that was rejected with state that there is a relationship of knowledge of pre-midwifery pregnant woman about physiological change with the incident of insomnia in Debbie Clinic, Medan in 2020. Conclusion: one, after conducting research on the relationship of pregnant knowledge about physiological change in semester 3 with the incident of insomnia in Devi Medan Clinic in 2020, the following conclusion can be drawn. Based on the knowledge of the majority of good knowledge mother as many as 12 respondents. The recommendation, one is a
Okay,
recommendation for
I'm sorry,
pregnant.
Mrs. Evaratna.
Okay, thank
Time
you,
is
ma'am.
over. Okay, thank you for your presentation, Mrs. Okay, ladies and gentlemen, next to the last presenter for the third oral presentation, please welcome Madam Rosmani Sinaga. Are you in there, Madam?
Okay, I will hear.
Okay, please presentation your material.
Okay, thank you for the time and greeting purpose for all of us. My name is Rosmani Sinaga, a lecturer from Stikas Mestra Husada Medan, Indonesia. I want my oral presentation with the title Relationship between knowledge and adolescent outreach forward communication sexual HIV or AH decision in Sarion High School, Tigapana. Next. Primarily, reproductive health is a state of physical, mental, or social well-being as well, which is not merely free from disease, as disability is a major relation to the reproductive system as well as its function and process. Next. Phase. The aim of adolescent reproductive health program is help adolescents to understand and be out of the knowledge so that they have well attitude and behavior and actually responsible for their relationship with reproductive life issues. Effort can be made through a focused promotion, age counseling and service to adolescents who have special problems and providing support to your activities they are fostered. The UNICEF survey showed that 41% of adolescents do not know how to recognize people with HIV or AIDS. Under this condition is not sufficient at national level as Juni 2004. The number of HIV/AIDS cases among adolescents reached 30% of all cases, 1.252 of 4.159. The result of national survey conducted by EA Indonesia AIDS Foundation showing the people infected with. Next. Research purpose to find out relations between knowledge attributed of adolescents toward HIV/AIDS sexually transmitted disease in Sino High School, Tigapana, 2019. Research method. Research type and design. The type of research is used a quantitative cross-sectional approach carried out a group of objectives which usually aims to see the relationship of knowledge or attribution of adolescents to sexually transmitted disease, HIV, or AIDS. Population and sample. The population is studied was 33 people. The sampling technique, the will accurate of our right is sample random sampling technique where the sampling is taken randomly. Result. From the table above, there is a relationship between knowledge and attitude of adolescents with p-value less of 0.05 or p equals 0.000. Next. Discussion. From the table above, there is a relationship between knowledge and attitude with the p-value less of 0.05 or p equals 0.000. This is in line with the theory that states attributed affect behavior if a positive attitude will behave positively toward, they will be done. Conclusion of the recommendation based on the rules of the study. The relationship of adolescent knowledge and adolescent attitude toward the sexual transmitted disease HIV or AH in senior high school Tigapana with 33 respondent and data processing that has been don't use SPSS. It can be concluded there is a relationship between knowledge and outreach of adolescent toward HIV or AH sexually transmitted disease with a p-value less of 0.05 or p equals 0.000. Thank you for remarks. I will send to the moderator.
Thank you very much for your presentation, madam. It's so very interesting for us. And ladies and gentlemen, next we come to question and answer session. And the committee has given to me the question. The first question, this is to Mrs. Pinta Situmorang. Hello, Mrs. Pinta.
Yeah.
Yeah. There is someone give a question to you. This is from Fahad, student of Bangladesh Agricultural University. Can you hear me?
Yes.
Yeah. The question is asthma patient dangerous for COVID-19?
Nochmal, also
Is asthma patient dangerous for COVID-19?
yes, of course. Can I of Germany?
I'm sorry, we cannot speak Germany.
There is people who can help me to translate. Or I can speak Indonesian.
Oh, maybe you can speak Indonesia. We will translate in here.
Jadi asma pasien itu apa ya? Rating yang tinggi kayak gitu untuk terkena COVID-19 kayak gitu, dan folgenya itu apa ya? Akibatnya itu juga tingginya rating kematian gitu sama dia kayak gitu sih. Karena kalau asma kan itu penyakitnya kan apa ya? Virus itu kan masuk dari rongga mulut tuh. Jadi kan kalau asma kan ada penyempitan rongga mulut. Jadi kalau bisa kita bayangkan kalau virusnya berdampak di situ, mau gimana pun apa ya, menetap di situ, berkembang di situ, kan jadinya sulit mau pakai yang apa alat untuk asma itu sih. Apa sih namanya? Aku tahunya bahasa Jerman. Terus itu nggak akan menolong karena kalau kita pun contohnya mau tes corona kayak gitu, yang mereka butuh itu ya tes yang di air liur yang ada di rongga kayak gitu. Jadi sebenarnya sangat berpengaruh dan harusnya hati-hati mereka yang
Okay, if I can translate like this, as a patient will high risk to COVID-19 because the vehicle or through what is the bacteria will be productive in there. The virus will be productive in there, like that. So very high high risk to asthma patient, right? Okay, thank you very much. Hopefully, Mr. Fahad, you can understand the question, the answer. Okay, thank you very much, Mrs. Pinta.
Thank you.
Okay, the next question. This is for Mutiara Asia. Are you still in there, Mutiara?
Yes, ma'am.
Okay, the question is from Octaria. The question is, how does the impact of reproductive health during the COVID-19 pandemic? Can you?
Yes, ma'am.
Yeah, okay.
Thank you, ma'am. I won't answer the question. Dudes, since the beginning of the COVID-19 pandemic, one concern has been that the elderly are more at risk of being affected by COVID-19, but actually the most I'm someone who was low understand such as pregnant woman, health and non-health impact on socially continue to occur from young and old age. Another impact is the increasing number of pregnancy during the COVID-19 pandemic. Besides that, ignorance in protection that stemless from PMS. Okay, thank you. I'm answer to Octavia Christine Sinaga, ma'am. Back to moderator.
Okay, thank you for the answer. Maybe the last question. This is to Destin. Do you still in there, Destin? Hello, Destin. Maybe she is not in here again. Maybe just until this for this third oral presentation. So, Mrs. Pinta Situmorang, thank you so much for joining with us. Guten Tag from here. And to the next oral presentation or the fourth session in this oral presentation, will guide or the moderator will guide with Mr. Okay. Hello, Mrs. Pinta Situmorang. Thank you so much for joining with us.
You're welcome.
Maybe in the next event, we can continue again. Okay. See you. Guten Tag, Mrs.
Yes. Good evening. Good evening, Laura.
Good afternoon in here. Okay. Okay, ladies and gentlemen, the next fourth oral presentation will guide me by Mr. Zulkarnain Batubara. Please welcome, Mr.
Thank you for Mrs. Retno given to me. And the next section or fourth section, before we start the presentation, I would like to read the judge for section 4 and 5. The judges are Eka Valentina Tarigan. Hello, Mrs. Eka. Are you there?
I have already here, sir.
Yeah.
Okay, thank you, Mrs. And the next judge, Febriana Sari, Mrs. Febriana Sari. Are you there, Mrs. Febriana?
Yes, sir. I'm here.
Okay, thank you. And the next judge, Siska Susi Triana Ginting.
Okay, sir. I'm ready.
Thank you, Mrs. Siska. And the second part, I will remember for the presenter, every person have 10 minutes for the present. And the next, the first presenter is Sari Duma Ambarita from the speakers Mitra Husada Medan. For Sari Duma, time is yours. Sari Duma, are you there? Okay, we will change by the presenter, and the next presenter is Magdalena Barus. For Mrs. Magdalena Barus, time is yours. Mrs. Magdalena,
Yes,
are you there, Mrs.?
yes, I'm here, sir. Hello, yes, I'm here. Turn on video. Hello, I'm here, Mister.
Okay, for Mrs. Magdalena, time is yours.
Good afternoon. Thank you. Can you hear my voice? Hello, good afternoon.
Good afternoon.
Good afternoon.
Good afternoon,
Miss.
Jim.
Good afternoon, Mister. Can you hear my voice?
Yes, please.
Yes. Okay. Thank you.
Mrs. Magdalena,
Yes,
turn
yes.
on your video, please.
Okay. Thank you. I'm nervous. Good afternoon. Thank you to the Almighty God because we are still given opportunity to meet despite the current pandemic condition. Those one who respect, please. It's okay. Good afternoon.
Good afternoon.
Okay, thank you very much. Thank you to the God because we are still given the opportunity to meet despite the current pandemic condition. Those one who respect the organizing committee and the audience, I will make a presentation for my research journal, but allow me to introduce myself. My name is Magdalena Barus, and I will present my research with title Factor Related with the Activities of Mother Toddlers age 24 age 16 months in visiting Posyandu, Dusun 6 in Kecamatan Patumbak, Kabupaten Deli Serdang. Next. Okay, background of the study. Based the date, it was consulted that the numbers of visit of mothers toddlers to Posyandu in Dusun 6 Kecamatan Patumbak, Kabupaten Deli Serdang in 2019 was not reached national target about 18%. Next.
Mrs. Magdalena, are you there?
Hello?
Hello, Mrs. Magdalena.
Hello? Can you hear my voice, sir?
Yes, Miss. Okay.
Next slide. The aim of the study is analyzing mother's knowledge, mother's attitude, her staff support, family support, posyandu distance with the activities of mothers toddlers age 24 age 16 months in visiting posyandu Dusun 6 in Kecamatan Patumba, Kabupaten Deli Serdang in 2020. Next. Method of study for this research is the kind of study to analytic survey with cross-sectional design, location and time in Dusun 6, Kecamatan Patumba, Kabupaten Deli Serdang. The study was started with priority spread that condition in January to Juni 2019. Next, population and sample study. The population was all the mother toddlers age 24 is 16 mothers in Dusun 6, Kecamatan Patumba is a sample. Next. Method of analyzing the data is use univariate data analyze, bivariate data analyze, and multivariate data analyze. Okay, this is the result of multivariate analyze. From the table, we know that variable of mother's attitude had p-value 0.041, so it was assumed that mother's attitude was the most influential variable x. The activities of mothers toddlers age 24 age 16 months in visiting posyandu. However, if it wasn't based on expected p-value b, it could be seen that the biggest value was family support variable about 8.264. So it could be assumed that mother who had family support had changed about 8.264 times more active to visiting posyandu. Next. Conclusion is that in the research, there were relations among mother knowledge, mother attitude, health staff support, family support, and distance of posyandu between the activities of mother toddlers at 24 age 16 months in visiting posyandu in Dusun 6, Kecamatan Patumba, Kabupaten Deli Serdang in 2020. Mother's attitude was the most influential variable against the activity of mothers toddlers age 24 age 16 in visiting posyandu seen from post p-value in multivariate analyze about 0.041. Based on the value of xb in multivariate analyze.
The time is over. Thank you for the nice presentation. And the next, we will continue the next speaker, Widya Sarah from Stikes Mitra Husada Medan. For Widya Sarah, time is yours.
Okay, thank you for moderator that given time to me. Let me introduce myself. My name is Widya Sarah from Bachelor of Midwifery Mitra Husada Medan, Indonesia. I will present about the influence of baby massage on baby sleep quality in 3 until 4 months in BPM Pera Simalingkar B, Medan in 2018. Next slide. Okay, introduction. Baby massage is a fun way to relieve tension and anxiety, especially in infants. Gentle massage will help relax the muscle so that the baby becomes calm and sleeps soundly. Data BPM parasympathetic B in 2018, out of 30 babies, including 22 babies reported having problem while sleeping, so they experience quality sleep. Okay, next. Infant mortality rate, or EMR, in Asian, WHO estimates a total EMR of around 170,000 per 1,000 live births. 19% of this figure occurs in Indonesia, Bangladesh, Nepal, and Myanmar. The EMR in 2015 was 22.23 per 1,000 live births, which means that the target of 2015 Millennium Development Goals, or MDGs, was 23 per 1,000 live births from Indonesian Health Profile 2015. The infant mortality rate, or EMR, in North Sumatra in 2013 was 21.59 per 1,000 live births, and in 2014 it was 20.22 per 1,000 live births from North Sumatra Health Profile 2014. Next slide. One effort to improve the quality of baby sleep is a baby massage. Next slide. What is a baby massage? Baby massage is a health care and treatment that has been known since the beginning of man to be created in the world and has been practiced since centuries ago by traditional birth attendants. The baby is called a child who is reared from 0 until 12 months. The benefits of baby massage is increased body weight and growth, increased endurance, increased milk production, build bonds of gratitude for parents and children or bonding, increase baby concentration, and make babies sleep soundly. Next. Methods is quasi-experiment with one group pre-test design and post-test design. The population is in the study is where all mothers of infants aged 3 until 4 months who visit BPM Parasimilingkar B in June until July 2018, as many as 30 people. The sample in this study were all mothers of infants aged 3 until 4 months who visit BPM Parasimilingkar B in May 2018, as many as 13 people or total population. Next slide. Result. The result of study obtained the quality of sleep for infants aged 3 until 4 months before the baby message is good, that is 17 people or 56.7%, and the rest is poor sleep quality, that is 13 people or 14.3%. And after the baby message, the quality sleep is good to 24 people or 80%. And the rest is poor sleep quality, 6 people or 20%. There is an effect of message infants aged 0 until 6 months to the quality of sleep of babies before and after message. P-value. Okay, the conclusion, sleep quality of infants aged 3 until 4 months before the baby message is good is 17 people or 15.6%, and the rest is poor sleep quality, that is 13 people or 43.3%. Sleep quality of infants aged 3 until 4 months carried out baby message for 5 days. There is an influence of baby message aged 3 until 4 months to the quality of sleep of infants in a BPM Parasimilingkar B before and do message with a p-value of 0.017 less than 0.05. Okay, thank you for your attention. I will back to moderator.
Okay, thank you, Mrs. Widya Sara, for a nice presentation. And the next, we will continue the next presenter, Epi Rosida Sihombing. For Mrs. Epi Rosida Sihombing, time is yours.
Yes, sir. Now, this is my slide. I want to. Can you hear me?
Yes, I can. Next.
Okay, thank you, sir. Thank you for your time and place to me. Let me introduce myself. My name is Afirosida Sihombing, Bachelor of Midwifery. I am from Institute Health Science Mitra Husada Medan, Indonesia. I am to explain my topic, and my topic is the influence of classical music therapy on the labor pain in the one first phase impart to mother in active BPM of the palm oil village over the Langkat district 20 and 18. Okay, to introduction, childbirth is the process of expulsion from the conception of the uterus stroke the outside or vagina and term pregnancy on 37 under 42 weeks. Born spontaneously with a presence of the back of the head without complications. In classical music or instrumental like modern music which has a good effect to reduce labor pain from Somoyami 20 and 15. In population and sampling, this type of research is a quantitative research with quasi-experiment with the design of the research design use the post and pre-test design. That is study that used to group of subject, namely and control intervention group. The population in the study were 32 mother and 32 sample were divided into two groups. The sampling technique used was total sampling, the collection of observational research data, and directly carried out by researchers. In the result of the study showed the average pain intensity of the intervention group was 7.31, and after being given classical music therapy in the discrete to 13.69. In the control group, the average pain intensity in intervention group was 4.88. And after being given a non-music therapy classic experience increased to 5.56. Next, conclusion. Based on the result of the study, it can be concluded that classical music therapy has a significant effect on pain reduction and can be used in the practice of independent midwife and complementary therapy to reduce the intensity of pain in the mother during labor. Okay, thank you, sir. I give back to moderate. Thank you.
Okay, thank you for the nice presentation. And the next, we will continue next speaker, Octaria Christine Tambunan. Octaria Christine, are you there?
Yes, sir, I'm here.
For the Octaria Christine, time is yours.
Thank you to moderator for the time to me. Okay, introduce myself. My name is Octaria Christine, and now I want to bring presentation about reproductive health of pregnant and breastfeeding women in the pandemic COVID-19. Okay, the introduce is the high maternal mortality rate or MMR in relation to reproductive health indicates that there are still major problems in the health of mother Indonesia in the world. According to data from Ministry of Health in 2019, still 2019, maternal mortality in Indonesia research 305 per 100 live births. The causes is level of education and discrimination women in community. The education have related with health. If the woman have good education, she will understand about nutrition and health for herself and her family. Next. Next, sir.
I can hear your voice.
Next.
Okay, thank you.
Yes, sir. Health service for women are identical to health service during pregnancy and childbirth. During pregnancy, several diseases often approach the mother, such as malaria, hepatitis, and others, including COVID-19. Emergency data shows that since the outbreak COVID-19, violence against women and girls, and particularly domestic violence, has intensified. In French, reports of domestic violence have increased by 13% since the lockdown on March 17. In Argentina, emergency calls for domestic violence cases have increased by 25% since the lockdown on March 20. In Cyprus and Singapore, health nurses have registered an increase in calls of 13% and 33% respectively. Increased cases of domestic violence and demand for emergency violence.
Excuse me, Mrs. Octaria. I can hear your voice. You must higher your volume.
Hello, sir.
Volume.
Are you hear me? Hello? Can you hear me?
Yes. Okay.
Okay. Increased cases of domestic violence and demand for emergency shelter have also been reported in Canada, Germany, Spain, the United Kingdom, and the United States. Next, sir. Next slide, please. Hello, can you hear me, sir? Hello,
Please.
can you hear me? Yes.
Okay. Okay. Yes,
Thank
I
you.
hear.
Problem experienced by pregnant and lactating women during the COVID-19 pandemic is pregnant women became the group that experienced great cancer during the COVID-19 pandemic. Mothers should be more routine of prenatal care before delivery, anxiety about the condition of yourself and the baby to be born, low up anxiety after the baby is born, and the less concern for breastfeeding her baby. Next slide, sir. Next slide, please. Okay. Antenatal care during the pandemic of COVID-19. The first, pregnant women are more at risk of being infected with the coronavirus because their immune system tends to be weaker. If there is not urgent need, pregnant women are advised not to travel outside the home during the COVID-19 pandemic. Pregnancy checks still need to be done routinely to monitor the health of pregnant women and the fetus. And the next slide. Something that pregnant and breastfeeding mothers needed to know during the COVID-19 pandemic period in order not to worry too about her and her fetus. The coronavirus can be transmitted from the mother to fetus during pregnancy. The corona or COVID-19 virus is not present in suspected breast milk.
Okay, thank you, Mrs. Octaria. Time is over. Thank you. Nice presentation. And the next, we will continue the next speaker, Magdalena from Stikas Mitra Husada Medan. For Magdalena, time.
Yes, sir. Okay, sir. Thank you for the time was given to me. For the first time, I want to introduce myself. My name is Magdalena, and I'm student colleague of Mitra Husada Health Indonesia. And the title of my research is Condom Use Mistakes in Prevention of Transmission of Sexually Transmitted Infection in the Pandemic COVID-19. Next slide. Okay. The definition of sexually transmitted disease are commonly known as sexually transmitted infection, are infections that are generally transmitted through unprotected sex. The spread can be through blood, sperm, or other body fluids. In addition, the spread can be through the use of shingles repeatedly or alternately among several people. Next. Okay, we must know what is the causes of this case. The first, syphilis caused by Treponema pallidum, then gonorrhea. caused by Neisseria gonorrhoeae and chlamydia, caused by chlamydia trachomatis, and genital warts caused by human papillomavirus, and the last, HIV, caused by human immunodeficiency virus. Next slide. After we know what's the causes of this case, we must know what's the symptoms of this case. The first, have a change in urine, pain during sex, warts or bruises, then pelvic pain or lower abdomen, then Miss P feels hot or itchy, then abnormal vaginal discharge or vaginal bleeding, fluid out of Mr. V, and urination feels painful or hard. Next slide, sir. Yes. Now you want to know what is the complication of this case. Pelvic pain dan pregnancy complication. Pregnancy complication like low birth weight baby, pneumonia, premature rupture of membranes, and until the death of the baby. Then eyes inflammation, arthritis, pelvic inflammatory disease, infertility, heart disease, cervical cancer, and anal cancer. Next slide. After we know what is the complication, we must know how to prevention of this case. The first, avoid sexual intercourse with more than one person. It's so important to us. The second, routinely maintain vaginal hygiene. And the third, always use safety device condom. And the fourth, we must take the vaccination. Next slide. And the results of my research is condoms have been widely recommended to prevent sexual infected disease, not only to prevent but able to handle this case. Because why I say like that, the effectiveness of condom reaches until 98%. Wow, the correct and consistent use of condom will provide maximum protection from the beginning to the end and every time you have sex. And the conclusion of my research is use condoms to prevent sexual infected disease. Your life is healthy, reproductive health prepared. I think only that. Thank you, sir.
Thank you for the nice presentation from Magdalena. And we will continue for the next presenter, Rahel Priscilla Marbun. Are you there, Rahel?
Okay, sir. I'm here.
Time is yours.
Good afternoon, everyone. Thank you for your attention. My name is Rahel Priscilla Marbun. I'm come from Indonesia. Thank you to moderate, give me time to deliver my research with the title, The Effect of the Message with Smooth Delivery of Peripheral Breast Milk in the Watch Area of Medan Gugur Health Center. Okay, immediately, I will explain what made me interested in doing this research. That is because to achieve the vision and mission from the Stikes Mitra Husada Medan based on complementary therapy, so that I do a back message that can be done for per woman. And here, I can see whatever this back message affect the smoothness of arch milks. Okay, this is my introduction from message bed and milk water. What is message bed? Message bed is in the cervical spine, back or along the spine vertebra to the 5 to 6 stretch bones. And benefit, help mother psychological, arouse self-confidence, help mother to have good talk about their babies, increase breast milk, facilitate breastfeeding, and win. What is milk water? Milk water is the best food that contains all the nutrition needed by infant age 0 to 6 months. This is my theoretical framework. Postpartum mother, you give back message. This is stimulation hormone prolactin and oxytocin. From this, you can see the smoothly or not smoothly from the mother postpartum. Okay, this is my research method. Is quasi-experiment. And the sample 32 people with purposive sampling technique. From the intervention group, 16 people. From the group control, 16 people. Dependent variable is back message. Independent variable is the smoothness of breast milk. Data collection is observation set, which are then processed using editing, coding, scoring, tabulation, and using the Wilson sign rank test statistic. This is my research results. It showed that there was a change in the number of respondents before batch message in the intervention group smoothly as many as 2 respondents, or 12%. After doing a batch message, smoothly of breast milk many as 14 respondents, or 88%. The results of the study were strained by the Wilson test result obtained p-value 0.000. This is my table. You can the analysis table first. Smooth milk water in the intervention control group before batch message. You underline before. From the group interventions, smoothly before batch message is 2 respondent and not smooth 14 respondent. From the group control, smoothly is 5 respondent and not smooth 11 respondent. Okay, the table 2, you can see smooth milk water in the intervention and control group after batch message. In table, different value from the group intervention before and after. Smoothly from the group intervention 14 respondent and not smooth 2 respondent. From the group control, smoothly 6 respondent and not smooth 10 respondent. Okay, my conclusion. Value of P 0.00 alpha less than 0.05, which means there is the influence of batch message with smooth breast milk. Okay, I finished to show my research and I'm come back to moderator. Thank you very much.
Okay, thank you for Rahel for the nice presentation. And we will continue the next presenter. The next presenter is Pipin Febriani Lumban. Are you there, Pipin? Mrs. Pipin, are you there?
Yes, sir.
Yes, time is for presentation.
Thank you, sir. Thank you for the time given to me. I want to introduce myself. My name is Vivi Febrian Mangaol. I am from Stikas Medan, Indonesia. Now I want to explain to the topic nutrition status of elderly based on knowledge and physical activity. Elderly human. The World Health WHO classification that elderly into four, namely middle age 45 until 59 years, elder 60 until 74 years, age 5 until 90 years, and very old age, very old for a lot of malnutrition in the according to WHO. Basically, malnutrition means malnutrition clinically. Malnutrition is
Okay, Mrs. Pipin, are you find a new place for the better connection? I think because in here I can't hear your voice. Yeah, Miss Pipin, are you there? Yeah, thank you for Miss Pipin. And we will continue the next presenter. The next presenter is Imarina Tarigan. For Imarina Tarigan, time is yours.
Okay, thank you very much for moderator Mr. Zulkarnain Batubara. May I to introduce myself? My name is Imarina Tarigan from Stikas Mitra Husada Medan, Indonesia. This is my research with the title Relationship Message with Intensity of Labor Pain in Mother in Part 2 1 Active Phase in Lastria Simamura Clinic. This is my research with Madam Mediana Burusembiring SST MKM. Introduction. Normal childbirth is a labor process that occurs naturally through a process of maternal uterine contraction and is passed through with an opening to expel the baby. From the above understanding, labor is a natural process in which cervical dilatation occurs, the birth of the baby and the placenta from the mother wombs. Childbirth pain is very worrying problem for mother in part 2, especially primigravida mother, and usually the most often done to reduce pain the meses method. Both the health worker, patient family, and patient themselves. Many pregnant women are afraid to do normal labor because of the level of pain they feel and are unable to cope, so choose to do caesar section. According to the World Health Organization, massage is hand pressure on soft part of body, usually a muscular and ligament, without causing movement of change in joint position to relieve pain, product relaxation, and or improve circulation. A very effective method in overfitting is by massage, which is one of the known pharmacological methods that is done to reduce labor pain. Massage is used to help relax and reduce pain through increased blood flow to affected areas, stimulating the receptor to touch the skin so that it relaxes musculus, change in skin temperature, and generally provide a feeling of comfort with conclusion of human relation. And the conclusion we can see together in table 4.1, distribution of response beside on pain intensity before and after done with back massage technique. With variable 1, pain intensity before mass result point mean 7.00. Variable pain intensity after massage 4.00 and different 3.000. It means pain intensity before massage higher than pain intensity after massage. Table 4.2, distribution of compression of respondent based on pain intensity before and after back massage technique. With variable pain intensity before and after massage, it means 3.000 and p-value 0.000. It means pain intensity after massage make maternity more comfortable than pain before massage. And there is a significant relationship between massage with intensity of labor pain. That's all my presentation. Thank you for your all kind attention and good afternoon.
Thank you for Mrs. Marina Tarigan, the nice presentation. And the next, we will continue with the next presenter, Sari Duma Ambarita. Sari Duma Ambarita, are you there, Sari? Okay, Sari Duma Ambarita, time is low.
Thank you for moderator for this time. I will introduce myself. My name is Sarindu Mambari and Jempura Regional Hospital.
Okay, excuse me. This is Sari. Can you turn your video? Turn on your video, please.
Objective to find out the relationship between excellent service midwifery service and maternal patient satisfaction in Tanjung Pura Hospital. Yeah. Yes, sir.
Okay, Sari Duma, Mrs. Sari Duma, can we continue your presentation?
Okay, sir. I will continue my presentation. Objective to find out relationship between excellent service midwifery service and maternal patient satisfaction in Tanjung Pura region. Regional Hospital in 2018. Introduction. The National Health System, or SKN, is that the goal of its development is the achievement of the ability to live a healthy life for its population, so that optimal health status can be realized as one of the elements of general welfare. One of the efforts to achieve this objective is comprehensive, integrated, and equitable health effort that can accepted and affordable by all people with an active community role, namely hospital referrals based on knowledge 2008. Based on preliminary survey conducted in all patients from January to June 2018, where researchers interviewed several patients in Tanjung Pura Regional Hospital to find out the satisfaction of maternity patients about midwifery service excellence service in the Tanjung Pura Regional Hospital. Apparently, from a number of patient opinion researchers, foreign patients were satisfied with the midwifery service at Tanjung Pura Regional Hospital. Material and methods is used analytic observational research. This research is to find out the relationship with Pura Regional Hospital in 2018 with analytic observational research with a sample of 63 people. Excellent midwifery service refers reliability, credibility, compensation. Result, the ratio of net in this study on 63 correspondents in Tanjung Pura Regional Hospital in 2018 state the excellent service to the satisfaction of unsatisfied maternity mother was 35 people or 83%, and to excellent service to the satisfaction of satisfied maternity mother there were 7 people or 70%. And the conclusion from the result of the study of relationship of midwifery service excellent service with maternity satisfaction at Tanjung Pura Regional Hospital, the following conclusion can be drawn. 1. Based on maternal satisfaction in excellent service midwifery service in Tanjung Pura Regional Hospital in 2018, the minority of service excellent good the satisfaction of the satisfied maternity mother, there was 5 people or 83%, and excellent service good satisfaction of satisfied maternity, there were 7 people.
Okay, thank you for Mrs. Sari Duma. Yeah, because time is over. Thanks for your nice presentation. We will continue the next presenter, Rizka Pasaribu. For Mrs. Rizka, are you there?
Okay, thank you for time, sir. My name is Rizka Susanti
People or
Pasaribu.
70%. And then benefit. Okay, sir. This is our presentation. Thank you.
Itu tadi mutkan aja Pak, mutkan aja.
Mutkan.
Hello, sir.
Yes, Miss.
Okay. Thank you, time, sir. My name is Rizka Susanti Pasaribu. My presentation about relationship between husband support and Alzheimer's second stage birth in Padang Bulan Health Center. My background: lack of mother's experience of childbirth will trigger anxiety. Anxiety is naturally felt by expectant mothers, but it will make mother this think more negatively and affect the pain during labor. This is when husband support is needed. Continual support from a labor companion can facilitate labor. For the mothers during the delivery process can facilitate labor, provide comfort, enthusiasm, and increase the confidence of the mother. husband's support in the delivery process is a source of strength for mother, then cannot be provided by health worker. The next slide. Okay, materials and method. The research use quantitative correlation method with cross-section design. My location research. The research will be at in the working area of Padang Bulan Health Center. And time, this is research was conducted from January 2019 until July 2019. My technique population. The population in this study was all maternity women who gave birth on the Padang Bulan Health Center in 2019. The number of samples in this study were taken by random sampling, which number 60 people. Method of collecting data. Number 1, primary data and secondary data. My result, the result of it in this study, the majority of respondents with the duration of the second stage of labor in prima 22 respondents and 73.3% received good support from her husband. Based on bivariate analysis, there is a significant relationship between husband support and the lack of second stage of labor in multigravida with a p-value of 0.001 or less than 0.05. Relationship between husband support and first stage of childbirth in primigravida. In multigravida, the majority of respondents with 2 second stage labor duration and multigravida is 14 respondents or 46.7% received good support from their husband. Based on bivariate analysis, there is significant relationship between husband support and the lack of second stage of labor in multigravida with a p-value of 0.001 or less than 0.05. The relationship between husband support and second stage of labor in multigravida. My suggestion is hope the health worker can make effort to improve the quality of midwifery service by presenting a husband where the mother gives birth as of from her husband support. Choose my presentation, sir. I came back to moderator. Thank you very much.
Thank you for the nice presentation, Mrs. Rizka. And the next, we will continue the next presenter, our Mrs. Lisa Putri Utami Damani. For Mrs., time is yours.
Waduh. Thank you, sir. I'm sorry. Okay, thank you for moderator for give me time to my presentation. My name is Lisa Putri Utami Damani. I will explain my presentation about the effect of oxytocin message using the onset of breast milk expenditure in the postpartum mother in the clinic of Hasna in 2019. Oxytocin message in one solution to overcome the smooth production of breast milk by missing along the spine or vertebra to the fifth after sixth costa bone. Oxytocin message provide comfort in the mother, reduce swelling, reduce block of my breast milk, and is an attempt to simulate the hormone prolactin and oxytocin after childbirth. This study aims to determine the effect of oxytocin message with the onset of the breast milk removal in postpartum mother in the Hasna clinic. This research is a quasi-experimental study with one group pre and post-test design research approach in the variable independent and variable dependent. Population of this study were all 2 hours postpartum mothers at the Hasna clinic. Population as much 30% and sample totaling 30 people with purposive sample technique. Data analysis technique used by independent test. And the research, this is table of test of normality. It means normality distribution data. Next. The mean time of colostrum expenditure in the postpartum mother intervention group oxytocin measures was 4.26 hours, and average time of colostrum expenditure in the postpartum mother was control group 5.10 hours. The result of statistical analysis p-value 0.026 less than alpha is 0.09. Next. Which mean there is an influence of oxytocin message with the onset of breast milk expenditure in the postpartum mother at the Hasna Clinic Medan Tembung in 29. Talk message or simulation of the spine natural transmitter which simulate the medulla oblongata, directly sending message to the hypothalamus in the posterior hypophysis to release oxytocin, which causes the breast milk secret milk. And thank you. I give back to moderator.
Thank you, Mrs. Lisa Putri Damanik, for the nice presentation. And we will continue the last presenter for this section, Mrs. Camelia Sinaga. For Mrs. Camelia Sinaga, time is yours.
Okay, thank you, the moderators. Good afternoon, all. Thanks to the moderator, given time to me or in oral presentation. My name Camelia Sinaga from Stikes Mitra Usada Medan. The title of my research, the correlation of childbirth confinement with childbirth smoothness in women in area Vera Clinic, Medan City, 2019. Next. State and maternal mortality rate in Indonesia still high. One of the reasons for the high maternal and perinatal mortality in Indonesia is prolate and labor. Smooth delivery as speed of labor. Next. Hypothesis. There is no relationship between the confinement role to the smoothness of childbirth. Childbirth confinement, husband and family involvement in providing support during and labor. Smooth delivery, the time need when the process of the spontaneous fetal discharge is less than 24 hours. The force of the study, determining the relationship of labor confinement to the smooth delivery of labor. The study was analytic, observational, with a phase control design conducted in January to June 2019. The total sample was the 132 respondent case in a group of mothers who have a smooth delivery, while control who have not smooth delivery. Samples were taken by technique purpose sampling. Research result. Data collection was carried on by conducting interview using and questionnaire, and then with bivariate chi-square. Bivariate analysis showed that childbirth with p-value 0.015 and odds ratio 2.x6719% had a significant associated with the smooth delivery. Conclusion, we suggested to heart workers in the heart center to improve heart formation and education to nurse and labor assistant about the importance of childbirth confinement and to increase the kindness of a smooth delivery. Thanks. I give to the moderator.
Okay, thank you for Mrs. Camelia Sinaga. And the next we will continue.
Sir.
We will continue about the answer and question section. And the question 1 from Penny Andenina to Magdalena Diploma 3. And the question is how to handle the pregnant women who are exposed to sexually transmitted disease. And what are the basic steps to prevent this case? Magdalena, are you? Yeah, can you hear my question?
Can you hear the question? I will answer. The question how to handle the pregnant. The doctor for the first time will give the antibiotic. Then the doctor will monitoring is done for terminating the pregnancy or further treatment to reduce the risk of pregnancy or childbirth. Then the first step to prevention. If you are not married, do not have sexual relation before the secret. Then if you are married, consider the risk that will occur if this case occurs to you or your partner. Limit the number of sexual partners. The more partners you have, the more likely you are to get in sexual transmitted disease. But if you have more than one sex partner, keep using condoms as the main protection for your reproductive health. I think it's the answer. Thank you, sir.
Thank you. How about you, Penny Andenina? Can you accept it?
Yes, sir.
Elena answer?
Yes.
Okay, next we will continue the question from Nikmatul Isnania to Rahel. Rahel, are you there?
Okay, sir. Okay, sir.
Okay, the question is, there is any difficult when doing this research?
Okay. Okay, thank you to moderate. Give me time to answer from the Datul. My answer is, of course, a research must have their own difficult, right? Especially in Indonesia, where have not only one religion or one tribe, so there are a lot of rules that can occur to someone. For example, when I want to do this back message, then I have to open the mother clothes. And there are some mother who don't want their clothes to be open, right? And example 2, there is also when doing a base message. So I told her husband to want to do this message his wife. But apparently her husband did not want to end this every unhelpful when I did. This research actually the difficult the message, but the hard thing is the approval. Thereof, before we take any action, we must first give informed consent. Thank you.
Okay, I think that's nice answer. How about the Nikmatul Isnania? Can you accept it? Right answer?
Yes,
Nikmatul?
thank you.
Yes.
Yes, thank you, sir.
Okay, thank you.
Thank you for answer.
Okay, thank you. I think that's enough for fourth section. And the next section will be moderated by Mrs. Retno.
Thank you for the time that given to me, Mr. Zulkarnain. Now we come to the oral presentation session 5. And the presenter I remind again to presenter that okay, before we continue the oral presentation, maybe we can see in our profile letter. Thank you.
My name is Dasen Mulantundraha. I come from NES Iceland, and don't forget I'm second semester. Well, I will introduce my campus. Why I choose in this campus? Because in this campus so very clean, and then there are 6 buildings such as clinic, ANC, INC, mosque, and laboratorium English and computer. In laboratorium English has earphone, computer, and internet.
Action goals: stimulate development baby's brain with stimulate the brain nerves in the big two area. So much action. Goal keep our digestive system help with directing the hand toward the big intestine, so gas in the stomach is removed. Action. The first action, moon and sun, and the second action, I love.
Okay, good afternoon. We will, before we start to the next session, we will show you the performance of the student Tikes Mitra Husada Medan.
Or use a different speaker. Dev aja lah dulu aku ya, Dek. Speakernya nggak ada. Itu nanti aku salah ngomong.
For all participants, wait a moment, please.
Makan sirih berpinang-pinang, lambanglah ada pusaka.
today. Thank you for all participants because you still in front of your monitor to see the dance of student Stikes Mitra Usada Medan. Now we are going to the last section, oral presenter. The section 5, we have 9 oral presenter. The first oral presenter is Desrima. Desrima, are you there?
Yes, I'm here, sir.
Okay, thank you. Now, time is yours.
Okay, thank you for moderate, for give me time to explain my research. Okay, good afternoon, everyone. Let me introduce myself. My name is Desrima Haryati Siombing. I come from Stikes Mitra Usada Medan, Indonesia. Okay, I will explain my research with the title, The Relationship of Breastfeeding Technique with the Occurrence of Blitters on Nipples Milk in Breastfeeding Mother in the work area of the Glugur Darat Health Center in its Medan district. Why I like this title? Because I see in profile North Sumatra, it is to target less than 10%. There are cases blister nipple, mastitis, abscess, and etc. Therefore, I research in Medan City. Okay, let's start. The first introduction. What is nipples, blister, and breastfeeding technique? Nipples blisters. There is correct breastfeeding technique is how to give breast milk to babies properly. This is from Rini and Kumala 2016. Design of the baby in a good suckling position, namely, the first, his body close together and direct at mother. The second, his mouth and chin close to birth. The third, the areola are not visible. The fourth, the baby is seen making slow, deep puffs. And the fifth, the baby looks calm and happy. The sixth, mother does not feel any pain in the nipple. And breastfeeding technique, nipple blister, namely the presence of pain in the nipples. Breast crack when breastfeeding is caused by breastfeeding or improper breast care. Next slide, sir. Okay, I use research methods, namely cross-sectional. In population in this study was 118 people, and the sample is 45 people with purposive sampling technique and solving formula. Dependent variable is nipple blister, and independent variable is breastfeeding technique. Data collection is collecting checklist and questionnaire. Data which was then processed using editing, coding, coring, tabulating, and using the chi-square statistical t-test. Discussion from my research, there is mother who experienced blister nipples were 37 respondents in person, 68.5%, and those who did not experience blister nipples were 17 respondents in person, 31.5%. Respondents with incorrect breastfeeding technique who experienced blister nipples as many as 20 in person, 37 respondents. Incorrect breastfeeding techniques that didn't experience nipple blister as many as 0 respondents. Correct breastfeeding techniques that experience blister nipples as much as 17 in person, 31.5% respondents. Same incorrect breastfeeding technique that didn't experience blister nipple as many as 17. From the analysis, it is known that breastfeeding technique has a statistically significant relationship with the incidence of blister of nipples. There is P less than 0.05. Next, sir. This is the analysis, my research. There is the relationship of breastfeeding technique with the occurrence of blisters. We can see in the table, the first breastfeeding technique is true, have blisters 17, and not blisters 17, they are same. And breastfeeding technique wrong, have blisters 20 and not blisters 0. But we can say this very, very different for breastfeeding technique. Next slide, sir. Conclusion my research, there is value of P 0.00 alpha less than 0.05, which means that there is a correlation between breastfeeding techniques and the incidence of blisters on nipples in breastfeeding mothers in the working area of Medan's Blugur Darat Health Center. Next, sir. Suggestion my research to reader, it is to be able to apply the correct breastfeeding techniques so that the incidence of nipple does not occur again to reader of breastfeeding mothers who are outside. Okay, thank you, sir. This is my presentation research. If we want to question, I return it to the moderator. Thank you very much.
Thank you, Desrima, for the nice presentation. I hope you stay in your monitor because we have answer and question section. And the next speaker, the next oral presenter is Nikmatul. Nikmatul,
Thank
are
you,
you here?
sir.
Okay. Are you ready?
Sir.
Yeah.
Ready, sir.
Now is your turn, please.
Okay, thank you, sir. Thank you to the moderator. Give me time. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I will present a result of our result. Before I continue my matter, apologies if my word is still many that do not fit. My title result is service in free service excellent with patient satisfaction in Tandang Buhit Balige 2018 by Nikmatul Isnania. Abstract. In the district, City Hall provided the Sumatra Matang mortality rate AKI of 85 per 100,000 labor. The development and improvement of service engaged in the health sector has become serious concern by the community. The need for health service is very important to support and survival in the future. Excellent service or service excellence is concern of customer by providing the best service to facilitate the conferences, meeting net, and realizing their satisfaction so that they are always loyal. Introduction, the vision of the long-term national development 2015-2020 with ensure Indonesia to develop development to and progress. This vision realized for development mission. The mission of her development 2010-2014 is to improve the degree of public health through community improvement, including the private sector and civil society, protecting public health, ensuring availability of a plenary, equitable quality and fair health overall, ensuring the availability and equal distribution of health resource and reverse good governments. The basic requirements for her service are available and sustainable, acceptable and reasonable, easily acceptable, and quality. The definition of quality of question is that wise level to the level of perfection. Many factors cause patient dissatisfaction in health service or one of what in the quality of health service. Good service quality is no important to improve service and patient satisfaction. Satisfaction level of function and difference between perceived performance as expectation. In the performance in below expectation, the customer will be disappointed. Methods, material and methods. The research use quantitative result design with analytic result and cross-sectional team approach. Population is generation consisting of object subject that have certain qualities and characteristics determined by researchers to study and then draw conclusion. Research and result after the data is collection then the data process analysis follow. One, based on excellent service from the data option based on excellent. Number two, based on the level of patient satisfaction taken from 40 respondent in the majority if they're satisfied. Conclusion. Number one, from the result of the study in Canberra, seen that based on excellent service midwifery service. Number two, from the result of the study, it can be seen that based on the level of patient satisfaction is service is excellent. Number three, from the result of the study between the relationship of midwifery service excellent service with the level of patient satisfaction of 40 respondents who are satisfied with service excellent. Number four, there is significant relationship between the relationship of excellent service with the level of patient satisfaction in Puskesmas Tandang Buhit Balige. Next slide, sir. Have we done excellent service? Thank you. The time and place I submit to the moderator. Thank you, sir.
You're welcome, Nikmatul. So nice presentation. We hope you stay in monitor to wait the question from the participant, and we will continue now. The next the next oral presenter. It is Sriulina. Are you there, Sriulina?
Yes, I'm here, sir.
Okay, good. Okay, now is your turn, please.
Okay, thank you for moderator. Give me time. Let me introduce myself. My name is Riulina Kaloko. I come from Bachelor of Midwifery Institute of Health Science Mitra Husada Medan. And I will to present about management of midwifery care for pregnant women, maternity, postpartum, newborn, and family planning for Mrs. E in BPM Pera. This is the abstract. For the abstract, this is the aim or objective, providing midwifery care to third trimester pregnant women, maternity, postpartum, newborn, and family planning in BPM PERA using the midwifery management approach. And next slide. This is the introduction. The success of maternal health, of course, among others, can be seen from the indicator of the maternal mortality rate. Maternal mortality rate is the number of maternal deaths during pregnancy, maternity, postpartum, caused by pregnancy, maternity, postpartum, or its management, but not due to other causes such as accident or fall in every 100 live births. Pregnancy care prioritizes continuity of care is very important for women to get service from the small team of professionals because that way the development of their condition will be monitored at any time. Apart from that, they also become more trustworthy and often because the field they already know the caregiver. Diana Sulis 2016. Data obtained from BPM Perasos that client who met antenatal visit T1 and visit until T4 in the last 3 months in 2018 were 21 pregnant women. INC totaling 10 people and using family planning as many as 65 people. In addition, BPM Pera has a memorandum of understanding or MOU on institution survey in BPM Pera Medan. This is the material and method. The type of research uses the in the case study. The study was conducted to obtain a picture of health phenomena that occur in certain individual or group of population. In this case, the research wants to describe midwifery care for mother. Data collection techniques used by the author are in the form of interviews, measurement, examination, and observation using the SWOT method. The flash for this study was conducted at BPM Pera Medan, when the case study was carried out on the 14th of July 2018 to 4 of June 2019. Case study subject is a person who is used a respondent to take the case of normal maternity in the mother primipara. The subject in the case, this is a normal maternity, mother is 30 years old. Next. Conclusion. The pregnancy examination in Mrs. follow 70 of the 10T standard. Mother did not examine sexual transmitted disease and did not perform a case management. Normal childbirth age of 39 until 14 weeks and at time delivery did not find complication. The postpartum care until the 4th visit. Monitoring and supervision process with breastfeeding efficiently. Care of newborn, baby are given injection of vitamin and Habenol. Mother's family planning, care choose birth control implant, provides counseling for implantable contraceptive method, namely the side effect and benefit and different types of contraception. Okay, thank you. And until here my presentation, I think I will come back to moderator. Thank you.
You're welcome, Sri Kaloko. Nice and great topic for your presentation. And I hope you stay in the monitor to wait the question from the participant. And now we are going to the next oral presenter. She is Fanny. Are you there, Fanny?
Yes, sir. I'm here.
Thank you. Now is your turn, please.
Okay, thank you that you're giving to me. Okay, let me introduce myself. My name is Fanny Adinina. I'm from Stikes Mitra Medan, Indonesia. Today, I will bring presentation about menstrual cycle disorders during the COVID-19 pandemic. Menstrual disorders are disorders that occur in the menstrual cycle. There are a variety of menstrual disorders that can be experienced by women, ranging from menstrual blood that is too little or too much, menstrual pain until depression before menstruation or premenstrual dysphoric disorder. Next slide, please. Menstrual disorders in women are still fairly frequently, especially during the COVID-19 pandemic. Their menstruation comes 2 months, and some even don't menstruate for 5 months. Therefore, her services must provide her education and approach the community so that they receive advice or input from her services. The average menstrual cycle lasts for 28 days. However, sometimes there are irregularities that can be caused by health conditions such as endometriosis or polycystic ovary syndrome or PCOS. But during the coronavirus pandemic, many women also experience menstrual cycle disorders due to stress. Sarah Toller, a nursing health doctor and science writer in women's health applications, Clue says this is because stress activates certain hormone pathways that release cortisol, also known as stress hormones. Excess cortisol release can suppress normal reproductive hormone levels, potentially causes abnormal ovulation, which can interfere with your menstrual cycle. One of the health conditions that might occur is amenorrhea, which is when a person doesn't experience menstruation at all. Toller explained, this condition is common in people who have recently experienced certain trauma. However, daily stress can also affect how long a person's menstrual cycle. So there will be several factors that can cause a person really doesn't menstruate in certain months. When in isolation during this pandemic, many women experience menstrual cycle disorders caused by stress. This stress certainly occurs not apart from factor of financial instability, social isolation, and psychological difficulties. This general change that women may experience as a result of stress not only cause menstrual delays, but also even cause stalling, shortening their time, or experiencing more severe periods. For that, to overcome this is to rebalance the hormones in the body. For some advice to practice yoga, adjust focus and meditation in addition to doing regular aerobic exercise. That's all I can say. Thank you.
Thank you, Fanny, for a nice and good presentation. And now I hope you stay in the monitor to wait the question for you later. And now we are going to the next oral presenter. She is Hartanta. Are you there, Hartanta?
Okay, I'm here, sir.
Okay, thank you. Now is your turn, please.
Okay, thank you, sir, for this time. Before I explain my presentation, I want to introduce myself. My name is Hertanta Silaban. I am a student midwifery from Stikas Mitra Husada Medan, Indonesia. Okay, welcome to my presentation. My presentation about the effect of this minor gender on the decreased percentage of students in the state of Mitra Husada Medan in 2019. The next slide, sir. Okay. And this is research and discussion. The result of research conducted by researchers with the title, The Effect of this Minor Gymnastic Against Pain, Relief Against Students of Stikas Mitra Husada Medan in 2019. Next slide, sir. Okay. Characteristic of respondent is age. The frequency distribution of respondent by age can be seen that from 13 respondents, that majority at age less 20 years, were 16 respondents, but in the percent just 53.3%, and minority at age 21 up to 24 were 40 respondents, but in the percent just 46.7%. The next slide, sir. Okay, pain intensity before gymnastics can be concluded that the most dominant pain intensity that has the highest value is the severe pain intensity with a frequency of 70 respondents. The among and the maximum and minimum values, there is a moderate pain intensity with a frequency of 9 respondents, but in the percent just 13%. And the last is the minimum value found in the intensity of mild pain with a frequency just 4 respondents, but in the percent just 30.3%. Okay, the next slide. Okay, and this is pain intensity after gymnastic. Pain intensity after gymnastic can be concluded that the intensity of pain before exercise can be reduced in the intensity of severe pain. In the intensity of severe pain has a frequency of 3 respondents, but in the percent just 10%. The intensity of moderate pain has a frequency of 15 respondents, but in the percent just 15%. And the last, in the intensity of mild, pain has a frequency of 12 respondents, but in the percent just 14% respondent. The next slide, sir. Okay, and the next, the pair t-test result, so P equals 0.000 or P less 0.06, which is proof that the influence of this minor gymnastic against pain relief against student of Stikes Mitra Husada Medan in 2019. Okay, the next. The result of this study are also supported by the result of research conducted by Solman, where in the research he did intervention group using the pair t-test P equal 0.00 or P plus 0.06. While in the control group using the test using the alternative text, Blazing found values P equal 0.2176 or P less 0.06, which is mean gymnastic exercise affect the reduction of pain during menstruation. Okay, the next. And the next conclusion. Conclusion is the result of identification of this minor pain. So during menstruation, before exercising this minor, obtain an average of severe pain as many as 17 respondents. After doing gymnastic this minor, the average pain of this minor was moderate pain 15 respondents, but in the percent just 15%, and in mild pain 12 respondents just 14%. Okay, the next. And this is gymnastic movement. The next. The first and the second, and the next. Next, sir. Okay, and this is just it, my presentation about this minor. Thank you for attention. Good afternoon.
Good afternoon to Hartanta. Thank you very much for nice presentation. Before we continue to the next oral presenter, I want to read the question for from the chat room. Question to Fanny Adanina. Is stress factor alone then can cause menstrual disorders? Please answer to Miss Fanny.
Okay, thank you for that question. I will answer the question. So there are so many factors that influence menstrual disorder, including excessive prolactin hormone and PCOS. The first, excess prolactin hormone. Such menstruation can be caused by the abnormal production of the hormone prolactin. Hormone produced in pituitary gland will increase during lactation, but can also occur due to certain medical conditions such as kidney disease and pituitary gland tumors in the brain. The second, polycystic ovary syndrome or PCOS. PCOS is a condition in which there are abnormalities in hormones and metabolic system, so that the function of the ovaries is disrupted. That's the answer.
Thank you, Ms. Penny, for your explanation. We'll continue the next question to Desrima from Dr. Rina Puspita from Palembang. The question is, in your opinion, do all mothers who breastfeed their babies first experience blister?
Okay, thank you for the question, Dr. Rina. I'm very happy for question, Doc. I will try answer. I can say that all mothers who breastfeed for the first time experience blisters. All depend on them personally. There are those who experience it due to lack of knowledge and experience, and even do not know at all the correct breastfeeding technique. Therefore, when we are pregnant, it will be nice if we could find out information in our needs later. For example, of good breastfeeding techniques, and we have health works. Also forget to provide information important on the needs of mothers in each of us health, so or their mother who comes to our clinic. I think this is from individually. So I think this is answer, sir. I come back to moderate.
Nice answer. Thank you, Ms. Desrima. Now going to the next question from Selvi Indah to Nikmatul. To Ms. Nikmatul, the question is how to apply the excellent service to the patient.
Yes, thank you for the time and opportunity of the moderate. I will answer the question. By creating comfort between patient and health worker to create reciprocal communication to patient and accidental health worker will provide friendly, courteous, and good service. Together, we know that the recovery of patient is partly in the service provider and can realize service that customer satisfaction. Customer satisfaction is service and desires of patient have been fulfilled and satisfied. I hope we all always provide excellent service to patient. Amin. Thank you. I return to the moderator.
Thank you, Ms. Nikmatul. And next question to Ms. Rilina Keloko from Ms. Yuli. The question is, what is the purpose of the continue of the curve approach for one patient?
Okay, thank you, sir. Now I will to answer the question. My answer is the purpose pregnancy care priorities. Continuity of care is very important for women to get service from the small team of professionals, because that way the development of their condition will be monitored at any time. Apart from that, they also become more trustworthy and open because they feel they already know and they caregiver. Thank you, sir.
Thank you, Ms. Sri Keloko, for your explanation and answer to the participant. And now we are going to the next oral presenter from PhD student from Lincoln University, Mrs. Inka. Are you there?
Yes, sir.
Are you ready?
Ready.
Okay, now is your turn.
Okay, thank you for this time. Before I presented my research, I will introduce myself. My name is Inka Kristina Pangaribuan. I am the student Lincoln University College. The title of my research is the effect of Islamic religious therapy music on the lowering of labor pain level in infarto mothers in the Palm Health Center in Seberang District of Palm Oil District, Langkat District. And my team is Ma'am Esther Simanulang. Next. Introduction. Labor pain is a physiological condition. In physiology, labor pain begins to arise in the first stage of labor in the latent phase and active phase. In the latent phase, there is an opening up to 3 centimeter. In primigrapida, the first stage of labor can last until 20 hours. In multigrapida, until 14 hours. Pain is caused by uterine contraction and cervical dilatation. The longer the pain will get stronger, the peak of pain occurs in the active phase, where the complete opening up to 10 centimeter. The intensity of pain during labor affect the physiological condition of the mother, labor, and fetal well-being. Next. The purpose of our research is, first, to identify the scale of pain in the active phase before music. Wait. Second, to identify the decrease in pain scale after being given music therapy, and third, to analyze the different pain reduction in the stage before and after music therapy. Next. Pain intensity is a description of how separate the pain is felt by the individual. Measurement of pain intensity is very subjective and individual, and the possibility of pain in the same intensity is very different by two different people. A pain with an objective approach is most likely to use the physiological response to pain itself. Now we can see from the picture pain scale. Next. In the research use the type quantitative design with a quantitative quasi-experimental study with a pretest and post-test non-equivalent control group design, and variable independent and dependent. We can see labor pain to Islamic religious music therapy. We make two group experiment, and the second non-music therapy Islamic religion is group control. Next. Islamic religious music therapy is one method for relaxation technique that is really applied in maternity nursing practice, whereas Islamic religious music therapy is one of the effective distraction technique that can reduce physiological pain, stress, and maternity pain by diverting one attention from pain. Next. Besides religious music, Islam also functions as a control and is a technique to create comfort for the environment. When women give birth in the maternity room, music therapy can improve, restore, and maintain physical, mental, emotional, social, and spiritual health. This is due to Islamic religious music has because Islamic religious music is comfortable, soothing, relaxing, structure, and universal. Next. The result of our research is frequency distribution of maternity pain in the control group and treatment group during the pretest, so that subject in the treatment group were 2 or 10% in moderate pain, 10 or 15% separate pain, and 8 or 40% very separate pain, whereas the control group as many 2 or 10% with mild pain, 4 20% at moderate pain levels, 8 40% separate pain levels, and 6 30 at very separate maternity pain levels. The following histogram of the percentage of maternal pain level in the treatment and control groups during the pretest. Next. Frequency distribution of maternity pain in the control group and treatment group during the post-test. In the treatment group during the pretest, who experience a category of moderate pain scale, pain scale and pain scale is very great from 20 respondents. There is There were 10% moderate maternal respondents and 10 or 50% separate pain and 8 or 40 peri-separate pain. Islamic religious music increasing devotion, shooting hearts and minds. Religious music not only has an impact on human relation with God, but also has an impact on relationship between humans, namely tightening the relationship, and also if lived well, religious music can change a person's behavior. Next. The function of religious music is to fulfill religious needs, means to broadcast religion, entertainment media used in religious ceremonies, used in wedding ceremonies, for example, in Sunda, custom when going to carry out saweran. Based on the result of the data, it can be concluded that there are changes that occur after perform Islamic religious music, such as the feeling of relaxation, relax, and reduce maternity pain. I think until here our presentation. I give time for moderator. Thank you.
Thank you so much, Mrs. Inka, for nice topic and for great presentation. And we hope you stay in the monitor to wait the question from participant. Now we are going to the next oral presenter, Mrs. Teti Suryati. For Miss Teti, are you there?
Yes, sir.
Okay, thank you. Now is your turn, please.
Okay, thank you for the time. Hi, all participants and audience. I'm sure that all of you are still excited, right? Okay, my name is Teti Suryati Situmorang. The title of my article is The Effect of Family-Based Education on the Implementation of Early Breastfeeding Initiation. Introduction. In the golden period, the brain experiences the most rapid development is the history of its life. That is up to 80%. Failure of nutrient intake during this period has long-term effects that are difficult and even irreversible. Breast milk is the best meal early in life. The success of exclusive breastfeeding starts from the implementation on the early breastfeeding process. And this, I will tell you the problem. This is the problem. The length of time that breast milk first comes out is the biggest cause. There are greater than 50% of failure to initiate early breastfeeding. Getting worse by the perception of family or community that the cause of babies crying after breastfeeding is because breast milk is not enough. It is necessary to be given formulation milk. The Healthy Indonesian program with a family approach states the family approach is the key to the success of the program. Family-based educational intervention for pregnant women about the initiation of early breastfeeding need to be done. Aim of research. There are 3 aims. First, to determine the level of knowledge and attitudes or participant before and after given family-based education. Second, to know the implementation of early breastfeeding initiation in the control and intervention group participants. Third, to analyze the effect of family-based education on the implementation of early breastfeeding initiation. Methods. Disease research is analytic research. This research is a quantitative study using a quasi-experiment, pre-test and post-test with control group design. Sample are women in 3rd trimester pregnant. The number of sample are 40 people, consisting of 20 people in the control group and 20 people in the intervention group. Data analyzed used to test. First, Wilcoxon test. to test the knowledge and attitude variables at pre and post test. Second, man-Whitney test, to test the difference in the implementation of early breastfeeding initiation between control and intervention groups. Result and discussion. Next slide. We can see in the table 1, in the control group, the knowledge and attitude variables have the same p-value, which is 0.564. In the intervention group, knowledge variable has p-value 0.003, and the attitude variables has p-value 0.002. In the table 2, the result of differences in the test of early breastfeeding initiation with the man-Whitney test, we can see the p-value is 0.004. In the intervention group, there was an increase in the percentage of good knowledge by 45%, a change in negative attitudes to positive by 50%, whereas the control group didn't experience an increase at all. Man-Whitney test result show a significant difference in the early breastfeeding initiation in the control and intervention groups. A strategy to increase knowledge and attitudes is providing family-based education so that awareness arises to do something that is already known. After the mother and family receive education, reading information about early breastfeeding initiation, this knowledge brings the mother into thinking, desiring, and trying to make her baby at birth experience the process of initiating early breastfeeding. Babies born healthy don't need to get help to carry out the process of initiating breastfeeding, as naturally, newborn babies have olfactory reflex and visual. That is, the baby is able to recognize the areola and the characteristic odor of the breast of the mother. In addition, other factors that facilitate the process of initiating early breastfeeding are that newborn babies have the reflex of seeking and sucking the nipples of mother's milk. This fact increased the optimism of mother and family to carry out the process of breastfeeding early during labor. Conclusion. First, the percentage of good knowledge categories and positive attitudes in the intervention group was greater than the control group. Second, the percentage of the intervention group who initiate early breastfeeding was 4 times of the group control. That is 60% in the intervention group and 15% in the control group. Third, there is effect of family-based education on the implementation of early breastfeeding initiation. And these are some picture of my research activity. I have some picture of my research activity. Yeah, there are activity of retest, family-based education, activity of post-test. Next picture, an early breastfeeding initiation implementation. Thank you for your attention. Good afternoon. I return to moderator.
Thank you for nice presentation, Mrs. Teti. And I'm so interested with your topic, and so nice your picture that you take. And now we are going to the next oral presenter. She is Mrs. Juliana. For Mrs. Juliana, are you there?
Yes, sir. I'm here.
Okay, please. Now is your turn.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everybody. I will explain our research.
Mrs. Juliana,
Yes?
can you make your voice louder?
Sorry, sir. Good afternoon, sir. Okay, sir.
Okay. If you can louder is better. Thank you.
Okay, sir. Thank you. I will explain our research. My name is Juliana Munte. My topic determined in the relationship between breast care and the incidence of breast milk dimes in the NS Baby Spa and Mom Care Clinic Medan Johor, District Medan City in 2019. Introduction. Breast milk dams are of mildew narrowing of the lactic ducts or by the gland not being emptied completely or due to abnormality in the nipples. And breast milk dam is the occurrence of swelling in the breast due to increased venous and lymph flow which cause mixed dams and pain accompanied by an increase in body temperature. The purpose of the study determined in the relationship between breast care and the incidence of breast milk dams in the NS Baby Spa and Mom Care Clinic Medan Johor, District Medan City in 2018. Next. My method. This type of research is an observational analytic case control study approach. The population was all breastfeeding mothers who experienced breastfeeding dam even in the 2018 NS Baby Spa and Mom Care Clinic. And total respondent is 80 people. The number of sample used was 30 people, obtained using simple random sampling technique, data collection using questionnaire and checklist to monitor the management of breast care. Next, analysis data technique and analysis data technique and checklist to monitor the management of breast care. Analysis technique using the chi-square test. Next. The result obtained are p-value 0,000, which means there is a relationship between breast care and the incidence of breast milk dams at the NS Baby Spa and Mom Care Clinic in Medan Johor District, Medan City in 2018. Until here, moderator, I come back to you. Thank you.
Thank you, Mrs. Juliana. Thank you for nice presentation and nice topic. And I hope you stay in the monitor to wait the question for you. And then we are going to the next oral presenter, Mrs. Retno Wahyuni. Are you there? Okay, now time is yours.
Okay, thank you for the opportunity that given to me, to moderator. Good afternoon to everybody. And I want to explain about our research with the title Relationship Between Pregnant Women's Knowledge of Mild and Anemia with the Compliance of Consuming FA Tablets in Remenda Tarigan Clinic, Medan City. And the author by Retno Wahyuni, Berti Wulandari, and also Kismiasi Aditya. Introduction. One of component of the maternal health care service is the administration of iron, as such as 90 tablet FA or Fa, iron is mineral that the body needs to form red cell or hemoglobin. During pregnancy, the intake of iron should be supplemented as long as it is pregnant. Blood volume in the mother's body increase, so to be able to meet the needs of mothers and oxygen in the fetus through the placenta, it is needed more iron intake. This is from Ministry of Republic of Indonesia. And also, based on the initial survey, which was taken by Rimenda Borutarigan, there are 10 mothers who have anemia. And of 10 pregnant mothers, there are 3 people whose knowledge is sufficient about anemia and the importance of consuming the tablet FA. And seven people who know less and do not know the importance of consuming tablets FA. Aim or objective. Anemia in pregnancy can have adverse effect on the mother, both during pregnancy, during and labor, the puerperium, and later. In pregnant women, this iron or Fa deficiency can cause miscarriage, premature babies, low birth weight babies or LBW, bleeding before and during delivery, and even maternal and even mortality are risks faced by pregnant women who experience severe anemia. This study aims to determine the relationship of knowledge of pregnant women about anemia with adherence of consuming FA tablet. And to material and method. In this research, knowledge is one of the factors that influence the formation of health behavior. Non-compliance of pregnant women taking FA tablets can reflect the greater change of developing anemia. This study is an analytical survey with the population taken is all pregnant women who have mild anemia in Rimenda Clinic in 2019 and a sample of 35 people. Knowledge and compliance assessments using questionnaires. And for the research results show that 42.86% of respondents lack knowledge, and there are 37.14% of respondents who obey. So statistical tests using the chi-square test of 10, and the result is p-value same 0.00 or also p less than 0.05. And the conclusion is H0 is rejected and HA is accepted, which mean there is a correlation between knowledge of anemic pregnant woman with adherence of consuming FA tablet at Rimenda Borutarigan Clinic in Medan, Denai 2019. That's all. Thank you very much for your attention. I give it back to moderator. Good afternoon.
Thank you so much, Mrs. Retno Wahyuni, for nice and good presentation. And now we are going to the last oral presenter in this seminar. Please welcome to Mrs. Kismi. Now, time is yours.
Okay, thank you to moderator for giving me time to my presentation. My name is Kismi Asihaditya. I will explain my presentation about the effect of giving ginger to reducing hyperemesis gravidarum in pregnant women in the Nana Diana's Clinic, Medan City. Background: hyperemesis gravidarum is a complaint experienced by pregnant women that interferes with daily activities, decreased appetite to cause disturbed nutrition to the fetus. Hyperemesis gravidarum can increase the risk of pregnancy disorders. Ginger is an herb that has long been known to prevent nausea and vomiting, that contains ginger's compound which has antiemetic activity, metocomplaint compounds that induce nausea and vomiting. The incidence of hyperemesis gravidarum in Indonesia in 2016 is 15 until 3% of the total number of pregnant women. Most causes of maternal death are bleeding pregnant, 70 until 80% have morning sickness, and as many 25.2%, infection 11.1%, sepsis 15%, hypertension in pregnancy 12%, complication of abortion are not safe 30%, and other causes 8%. Purpose: this study aims to determine the effect of empiric ginger in reducing hyperemesis gravidarum in pregnant women at Nana Diana Clinic Medan City in 2009. The method: design result is quasi-experiment with one group pre-test post-test design. Sample is first trimester pregnant woman. There are 32 respondents for each experimental and control groups. Sample technique using total sampling and data analysis using per t-test. Result: average frequency of hyperemesis gravidarum in the experimental group before given ginger as much as 2.38 times a day and decreased to 1.00 times a day. Bivariate test results show that one ginger drinks were effective in reducing nausea and vomiting in pregnant women with p-value 0.000. Conclusion: giving warm ginger drink is effective in reducing the frequency nausea and vomiting in first trimester pregnant women. Okay, thank you. I give it back to moderator.
Thank you so much to Mrs. Kismi for nice and great presentation. Now we are going to the question and answer section. I will read the question from Zoom and also from YouTube. The first question from Siti Nurfadila to Mrs. Inka. The question is the music playing during process labor?
Okay, thank you for the question. I will answer. The music will playing in labor, and before we play the music, we must give permission with the patient with informed consent. If the patient is agree, we can play the music, and the patient must cooperative so that we can do the technique. I think that's all. Thank you.
Mrs. Inka, because so many participants interesting to your topic, so we still have one question more for you. The question from Mrs. Siska Ginting. The question is, how music can affect the relaxed state and how to overcome his anxiety?
Okay, thank you for a second question from Ma'am Siska. I will answer. How the music can decrease pain in labor? Because music can provide give energy to the woman, so that the woman can manage the breathing during labor pain. And the music can reduce stress, anxiety. When listen the music, we feel calm and happy, so that the endorphin hormone increase. With hormone endorphin, it can decrease the pain for woman labor. Thank you.
Thank you, Madam Inka, for nice and good explanation. And now we're going to the next question to Mrs. Juliana from Miss Ria Andriani. Yeah. The question is, can you explain how the number of mothers who experience breast milk dump? Please answer, Madam. Thank you.
Okay, thank you, sir. Thanks to question. I will answer. So, most of the respondents, 51, breastfeeding mothers who did not do breast care, while nearly half of the respondents, 48, breastfeeding mothers who did breast care and the NS Baby Spa and Mom Care Clinic Medan District Medan City in 2018. So, most of the respondents, 58, were breastfeeding mothers who experienced breast milk dams, where almost half of the respondents, 41, were breastfeeding mothers who did not experience breast milk dams. Thanks, moderator.
Thank you, Mrs. Juliana, for your explanation to the question. And then we are going to the next question from Mrs. Martaulina to Mrs. Retno. The question is, as midwife, in your research, how to make mother pregnant compliance to consume FE tablet? Thank you.
Thank you to moderator. I will try to answer question from Ma'am Marta Ulina. As you know that I am with my team when research, we give to the mother pregnant communication, and also we always home to door, door to door, and always check the hemoglobin the mother pregnant. So we also make the mother pregnant will be compliant. So just that, and also tell the family to always support the mother pregnant, so the hemoglobin will be increased like that. Maybe just that. I give it back to moderator.
Thank you, Mrs. Retno. And the last question for Mrs. Kismi. Okay, from Miss Nikmatul Isnaya. The question is, why ginger can reduce nausea and vomiting in pregnant women? Thank you.
Okay, thank you, moderator. I will answer the question from Nikmatul Isnania. Why ginger can reduce nausea and vomiting in pregnant women? Because
Excuse me.
Yes. Because ginger contains at least 19 components that are useful for the body, one of which is ginger, the most important compound, and has been proven to have enzymatic activity which is effective by blocking serotonin, a chemical messenger. This compound causes the stomach to contract, so that when blocked, then the muscle of digestive tract will relax and so the mass nausea and reduce. Thank you, moderator. I give it back.
Thank you, Mrs. Kismi. Now, times for oral presentation is over, and let's give the applause for us. So, the next agenda will continue to announce the best presenter and best article. But before that, we wait because the judges still discuss about that. And now while we wait, we see the profile again of Stikes Mitra Husada Medan. Ladies and gentlemen, now we are going to the next agenda. We had productive and inspiring time together during this event about calm and until end. We hope all activities on this conference are informative and helpful. Now, the time are waiting, the best paper announcement and the best oral presenter announcement. We will announce award for the best paper of the Mitra Husada Health International Conference 2020. And now I invite the judges, the head of the judges, Mrs. Lydia Sinuhaji, to announce the best paper and the best oral presenter.
Thank you for the moderator who gives time for us. I think all of you gives oral presentation and give article the best, but we must decide about some criteria, and we think we decide the best presenter of student. The best presenter of student, one, Widya Sarah from Tikas Mitra Husada Medan. Congratulations.
Please applause for the winner.
And number two, Tipapon from Sapakanazau University. Congratulations. And number three, Selfie Indah from Tikas Mitra Husada Medan. Number four, Magdalena from Tikas Mitra Husada Medan. Number five, Siti Nur Fadila from Tikas Mitra Husada Medan. Number six, May Christine Gia from Tikas Mitra Husada Medan. Congratulations all of you, and now the best presenter of lecture, who is number one, Janes Bastian, MKS from Citra Bangsa University, Kupang. Number two, Dr. Rina Puspita, MKS from Siti Kodida Palembang, Tikas Siti Kodida Palembang. And number three, who is Adelina Sembiring, escape nurse MK from Tikas Mitra Husada Medan.
Perawatan.
Number four, Lisa Putri Utama Diamanik, SSMT Aircraft from Tikas Mitra Husada Medan. And the last, Imarina Tarigan, SSTMKM from Tikas Mitra Husada Medan. Congratulations all of you.
Marina, berarti ku panjang umurnya.
Okay, congratulations, and I'm back to moderate. Thank you.
Oh, apa katanya, Mi? Siapa itu?
Congratulations for all the winner, and we want to take a photo of you. So please raise your hand. The winner for the winner. The best paper and the best oral. Please raise your hand. Okay, thank you. Congratulations for you.
Dengar bentar ya.
Okay, thank you very much for attention. And now we are going to the evaluation of this. Now we are going to the next agenda. impression and message from participant. The first participant, Dr. Rina, are you here, madam? To give the testimony or the impression and message during this conference.
Okay.
Please, time is yours.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good evening, ladies and gentlemen.
Good evening.
That commit this webinar choosing me to speak as closing statement to present oral participants today. I think we're already following this webinar since yesterday, and a lot of new information we already get yesterday. And from Malaysia, Dr. Shadid Pado also from Malaysia. We already hearing from Dr. Suton from Laos and Dr. Abu Bakar from Nigeria. Also from Mrs. Siti Nurmawan, Mrs. Siska Suci Triana Ginting from Indonesia, and also from other great speakers. This webinar for me is going so good and so interactive. I really appreciate that you guys prepare this international webinar really good. All team work together, and I know all team and speaker already joined Zoom from early morning. I think it's from 7 p.m. That really takes hard work, and congratulations for the committee. I think the first international webinar for me going really good, and me as a participant looking forward to Stickers Mitra Husada Medan to their second webinar, and I'm so happy to join again. If I may give you advice for your second webinar, it will be good if we talk about new normal. It can be about health practitioner, midwife, nurse, doctor, how they work in new normal, or maybe it's about education, how we must survive in this new normal. As a lecturer in my academic, because of coronavirus pandemic, the number of interest people who want to become doctor, nurse, and midwife is decreasing compared to before pandemic. And I think that's a very interesting thing for us to speak about that. Okay, finally, thank you so much, Stickers Mitra Husada Medan. Good job, and thank you. And I'm so happy that I become one of the winners as an oral presentation. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Rina.
Okay.
And now we are going to the impression and message from the Lao team. Are you there, sir?
Hello, yes, I'm here.
Yeah, can you give a testimony or the impression and message from you about this conference?
Okay, firstly, I would like to thank you for all the performance and presentations. And on behalf of Savannah Kids College of Health Sciences and the students that received the award, I am deeply honored to say thank you, and I'm really happy to be a part of these honor conferences. And I would like to say that if it's possible, and we would like to be a participant of this honorable event in the future, and we hope that in the future we can invite you and everybody from many institutions to visit our country, as well as Savannah Kids College of College of Health Sciences. Thank you.
Thank you.
Thank you, Mr. Vinay, for your testimony. And then we are going to the last impression and message from Indonesia. To Putri Bakara from Indonesia, please give the impression and message about this conference.
Okay, thank you, moderator, for the opportunity. And in the evening, we have the last
time for this event. We are very thank you to our God because this event has going good. And for the winner, we say thank you and congratulations. You have prepared before this day. And for who has not winner for this day, don't be afraid, don't be shy. We can continue doing the best for next conference, and we hope to all participants in another country, which is Laos and from Malaysia. Next, we can make some conference like international conference and more participants from another country. And also we have many experience such as about the research and collaboration research. And thank you for Stikes Mitra Usada. You has the best campus and good luck. And actually, this is my speech. Thank you very much.
Thank you. Thank you.
Thank you, Putri Bakara, for the impression and message for this conference. We're so proud of all participants. And now the next agenda, we want to continue the result of the evaluation of this conference, and will deliver by the head of evaluation team of Mitra Usada Medan, Mrs. Ishiosari. Now time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Hello, good afternoon, ladies and gentlemen. I hope you all have a good day. I will report my result about monitoring and evaluation schedule seminar international conference or MIHHICo, subtema emergency management COVID-19 of reproduction health for saving life, which in 29,000 Medan, Indonesia. Report of the seminar international is participant 250 speaker, Dr. Sande Podar from Lincoln University, Dr. Son Potasin from College of Health Science Savanket, Laos, Profesor Jahra Set, Dr. Ahmed Abu Bakar, Siska Sucitriana Ginting SSTM Kes, Febriana Sari SSTM TRKF, Mariani SSTM KM, Rosmega SSTM KM from Indonesia. From oral presentasi, 64 present is Laos 3 participant, Jerman 1 participant, Malay 2 participant, Indonesia, Palembang 1 participant, Kupang 1 participant, Palu 3 participant. About has a result monitoring evaluation about country of original domicile, profession, gender, attend webinar through, motivation for following webinar, how to material of native speaker, how to present of material facility, how time and management attended are used, the use of guide method and tool assistant in giving participant question, how to speaker, respond person give question to participant, how to speaker research person to answer participant question, the use of language is explaining material, implementation of interactive dialogue and mastering the audience, how to speaker research person motivate you to apply to knowledge guide during implementation, activities, equipment, audio visual, how to webinar was conducted, how to communicate server in the webinar is very good. About oral presentation is relative instead of presentation with topic, activity use presentation on time, presentation of material regular and sequentially, so presentation, articulation presentation, presentation speaking friendly and clearly, interesting and motivating presentation, mastering of sustained presentation, argumentation for ask and answer, skill of reading or language, content on completed, contradiction completeness, originally, display of material, strength implementation is very good. Is the report of monitoring evaluasi from UPMI. I am back to MC. Thank you.
Thank you, Mrs. Isyosari Sembiring. Now the next agenda is closing speech from the Chief of College Tikas Mitra Husada Medan, Indonesia for Madam Siti Nurmawan Sinaga. Time and place is yours.
Okay. Good morning, everyone. The Honorable, our presenter from Laos, Germany, from Indonesia, especially from Kupang and Palembang, and Honorable oral presentation from Indonesia. The Honorable all participation, the first Mitra Husada Health International Conference specialty from Bangladesh and Pakistan. I would like big thanks for our God because He given time and opportunity so this webinar international run good and fluently. Ladies and gentlemen, let me to report the result of the first Tikas Mitra Husada Medan Health International Conference. The conference we did 2 days. The number of participants in the conference are 80,510 participants. They come from India, Bangladesh University, Malaysia, Arab, Saudi, Laos, Germany, and Indonesia. The total oral presentation are 60-40. Oral presentation come from Laos, German, Malaysia, Indonesia, specialty from Palembang, Kupang, Palu, and Nur Sumatra. We are very proud because the enthusiasm of the participants of this conference, so many response we get from conference. Tikas Mitra Husada Medan will be committed to providing the best service in the next conference. In this occasion, I would like thanks for speaker Dr. Sandap Podar from Lincoln University, Dr. Santan Pontens and Vinay Kamsonpo from College and Health Science Sampanalao, from Professor Jahra Saad, Masa University, Dr. Hame Abu Bakar from Nigeria, and I also say thank you for Dr. Rina Puspita from Palembang for message and impression that have been given. Congratulations for the winner as the best presentation, the best participants, and the best article. And for not the winner, keep spirit and please join for the next conference with us. We are so sorry if we make mistakes in this conference. We are looking forward for our next conference together. I also thanks to all the commit and sponsorship for your participation and cooperation. We have learned and worked hard to conference. Hopefully, this conference will give a benefit for us. Lastly, I want to say, see you the next event. Thank you very much. Thank you. Thank you.
Thank you.
Thank you for Madam Siti Nurmawan Sinaga. Now we are going to the next agenda. Is closing prayer will deliver by Mr. Abdul Hafiz. For Mr. Abdul Hafiz, time is yours.
Thank you, sir. Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. In the name of Allah, the most merciful and the beneficent. All praise to be Allah, the sustainer of all the world. Peace be upon the Muhammad, the messenger of Allah. We are grateful today for your blessing we have crafted our meeting. And second day in the first webinar international Mitra Usada International Conference 2020 successful. My that we are doing and that we have done will give benefit to us and for strengthen brotherhood between our country, Indonesia, Laos, Malaysia, and Nigeria. O Allah, grant blessing and peace to the one whom the send us, mercy to all, the world and to all his family and companions. And have mercy on us and have mercy on the member of this webinar international. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Amin ya rabbal alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, Mrs. Hafiz. And the last agenda, we won't take a photo for all participants, so give the best smile. Untuk agenda terakhir, kita mau mengambil foto, jadi untuk semua partisipan, berikan senyum terbaikmu. Thank you for all participants. Ladies and gentlemen. Ladies and gentlemen, I'd like to thank all of speakers who have shared and given many knowledge, participants from Laos, Germany, Malaysia, Pakistan, Nigeria, and Indonesia. I also thanks to all of committee and sponsorship for your participation and cooperation, who have learned and heard throughout the conference. Hopefully, we able to see and influence our future. It's been a pleasure being with all of you during conference, and we are sorry if any mistake during conference. Before I close this event, I have two poems or pantun for you. Mangga gincu, mangga kueni, sangat manis keduanya. Cukup sudah sampai di sini. Terima kasih untuk perhatiannya. One more in English. Travel to Java past Truk Medan. Don't forget to buy lemper. Don't feel the end event. I say goodbye and see you later.
See you later.
Thank you very much.
Thank you, Pak Edi, Pak Jokati. Thank you. Thank you. Thank you.
Congratulations.
Congratulations. Thank you.
Thank you.
Pantunnya pula tadi. Jadi dia bahasa
Lemper.
Thank you.
Terima
Stickers
kasih.
Mitra Husada Medan.
Congratulations to Stickers Mitra Husada Medan.
See you.
Gitulah lalu.
Galis ya.
such as clinic, ANC, mostly, and laboratorium English and computer. In laboratorium English has earphone, computer, and internet.
Goals stimulate development baby's brain, which stimulate the brain nerves in the big two area. So much action. Goal keep our digestive system help with directing the hand toward the big intestine.